Roll then.
All right. Good evening, everyone. I would like to call the business meeting of the Portland Board of Public Education to order. It is August 17th, 2021, and we are meeting at Casco Bay High School and also remotely. Mr. Superintendent, will you please call the roll?
Yes, Madam Chair. Ms. Bondo.
Présente.
Mr. Burke.
Here.
Mr. Irish.
Here.
Senor Rodriguez.
Presente.
Ms. Russell Better.
Here.
Ms. Thompson.
Here.
Ms. Trevorrow.
Here.
Mr. Youssef.
Here.
Ms. Allen.
Here.
Ms. Boxer McCumber. Ms. Chung.
Here.
Ms. Hill. Ms. Yangala. And Chair Figdor.
Here. Okay, we are going to start with the Pledge of Allegiance. Will folks who are in the room stand up, and others can join us on Zoom. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation,
Under God.
indivisible, with liberty and justice for all.
Finally got it.
Okay, tonight we are starting our meeting with a presentation, an updated presentation from the superintendent on our reopening plan. Then we will move directly to a public hearing on our reopening plan. There'll be an additional opportunity later in the meeting for the public to again comment on our reopening plan when we formally consider and vote on it later on in the meeting. So there's two opportunities: a public hearing on the plan up front after the superintendent's proposal, and then later after the board has more of an opportunity to ask questions. So with that, I'm going to turn it over to Superintendent Batana.
Thank you. Greg, can I share my screen? I think I can. Great. Thank you, Madam Chair, and good evening, everyone. I wanted to walk through an update on our recommendations for school reopening. So this is a lot of information that you've seen before, as well as some new information, and I'll be walking through that for the next half hour or so. The updates that you'll see are based on feedback that we've received either from board members or from members of the public over the last couple of weeks. In some places, we'll provide additional details that are primarily based on some of the questions that you answered, and we'll attempt to answer some of the questions that were posed by the board. Some of the questions that were posed by the board, the information is included in the board docs packet. It won't necessarily walk through everything like the cleaning protocols and things along those lines, but those are included in the board packet. And those were in response to questions that were posed at the previous meeting on the 3rd. So again, just as we do whenever we do this, I want to just ground us in the guiding principles that we established last year and that we've found hold true throughout, which is sort of centering, making our decisions and reallocating and allocating resources based on our most marginalized students, prioritizing safety and wellness, trying to remain agile. So you'll see that we've adjusted and made changes as a result of the feedback that we've gotten. And, I can assure you that we will have to continue to do that. Trying to take advantage of this as an opportunity to increase coherence within the system and also to build our culture as an organization. So these are the proposed plans which you saw, and the places where we have bolded out are places where we've made some modifications, and so I'll be walking through those as I go through the presentation. So there's nothing that's been removed, there's nothing that's been added that wasn't in there, but we have made adjustments as I walk through. You will see where those adjustments come into play. I do want to point out something which I should have done earlier, that we're not going to take board questions on my update as part of my presentation. We're going to go straight from this into the public comment. Then when we bring this to the board for consideration is the time for you to ask additional questions and so on. So I apologize for not having said that up front. Okay, so let's start with a major change, which is staff masking. So previously we had said that that staff would be masked at all times when they were with students indoors, but that, you know, when they were indoors with other staff, particularly vaccinated staff, that they would not be masked. We received significant feedback around that. And so we adjusted that, and staff will be masked indoors at all times except when eating, and both when they're around students and other adults. So in essence, just basically universal masking throughout the day. We've also determined that we would limit indoor gatherings to 100 people, and only in those instances where we would be able to maintain 3 feet distance. So similar to the setting that we are currently in, so enough space in between people and masked, but that we would limit to 100 people. And so that may be like the auditorium at Portland High School or a gymnasium or something along those lines, is where large staff gatherings would take place. And, you know, any staff gathering that exceeds 100 people should be held outdoors, and we're encouraging outdoors for, you know, any opportunity. In fact, today we had our new our new staff orientation. We had that at East End, and we were at less than 100 people, but we did that outdoors in one of the tents for the entire meeting. So to just give you an idea that that's what we're trying to prioritize. So another major challenge that we've been trying to deal with, and you know this from the spring, that for us to be able to adhere to a 6 feet distancing during meals would mean that we would not be able to bring all of our students back. We also this year wanted to prioritize going back to a closer to normal meal program. So that includes serving warm meals to students. And so we can't do 6 feet universally, but we are confident that we're able to keep 3 feet distance. And we accomplished that at the elementary level through various approaches that range from having only 1 grade at a time in the lunchrooms, or, you know, having some classes eat in the lunchroom and other classes eat in the classroom, things along those lines. And then obviously leveraging outdoor space to the extent possible. And that's, you know, that's more achievable in some buildings than it is in others, you know, particularly if you think of some of the schools that are under construction this year where, you know, significant part of their outdoor space is construction space. Breakfast will be in the classroom in all cases where we're able to maintain the 3 feet distance. So at the middle school, similar arrangements, only one grade, 2 houses in the cafeteria at all times. In many cases, they'll be going to the lunchroom to get their meals and then bringing them back to the classroom to eat, where they can keep 3 feet distance. So we've also made some modifications to the use of the building by outside parties. We're limiting the use to after hours when students are not in the building. So no events where there are still activities going on in the school and things along those lines. As we did with staff, limiting the group size to 100, and, you know, any outside group that uses our facilities will have to follow the district's distancing and masking procedures. So all of our protocols, things along those lines. This is a work in progress. We want to be able to have visitors in our schools, something that we didn't do at all last year. You know, we have first graders whose parents have never actually set foot in their children's classroom. And I guess the same is true for sophomores at high school or seventh graders at the middle school. And so we want to be able to figure out how to do that. So right now, the guidance that we're operating under is small groups coming in at a time. So 4 or 5 people, something along those lines. And having them obviously be, masked, following social distancing, and limiting the time that they're in a classroom to no more than 15 minutes. So, so that's another sort of adjustment, expansion of what we had previously outlined. So I'm going to get into some of the layering, and this is where we're going to address some of the questions that you and members of the public have raised along the way. So just to recap, some of the things that we are continuing from last year, you can see those on the left-hand side, and then some of the things that we're revising, loosening, if you will, this year, and so those are the things on the right-hand side. So to, sort of the way to think about it, the core mitigation strategies that we've put in place, the ones that we feel are universally present and, are significant, is masking. So the universal masking for all students and staff, indoors and on public transportation, of course, and also on district transportation. And the other one is pooled testing for students in kindergarten through 6th grade. And we will be going into detail on that. And then, vaccinations, which, as you all know, is by far the most powerful tool that we have to be able to manage the pandemic. And so, in those places at this point where students are eligible to be vaccinated, we will be partnering with Greater Portland Health and with Northern Light to have in-school clinics to continue to increase the number of students who are vaccinated. As you know, the DOE will be reporting on student and staff vaccination rates. So we will be getting those reports, sometime at the beginning of September. So let's talk a little bit about the pooled testing. As you know, this is a new layer. We are in active work. Tina Valiu, our head nurse, has been working closely with the concentric staff and learning about how to set up to be able to do this. We're scheduled to begin that on September 20th. That will give us time to begin communicating after it's approved today. We're ready to roll out the consent forms that families need to sign in order to be able to participate in that. And we have a series of opportunities scheduled for folks from, for our multilingual center, for us to do outreach to families to help them to understand the value added of pool testing and the process for signing up. So the main reason that we're doing this, as you know, is because for students at those grade levels, the vaccine is not currently available. So this is something that is an added mitigation layer for the K through 6. We are considering expanding that. We want to first get started and make sure that we are able to carry out everything that we think we will be able to carry out with this layer, and then consider expanding that over time. Pre-kindergarten is an area where, if you recall at the last meeting, we had talked about potentially doing with pre-kindergarten. We've decided to pull back on that because of the resources that would be needed to be able to actually do the testing with those students. We're also looking at the possibility of using this with our student athletes. So again, we want to get started, with the larger K-6 group and then look at potential expansion as we learn more about it. So the way it works is it's a weekly pool test. It's voluntary. So as I mentioned earlier, we're ready to roll out the consent forms to get families to agree to participating. The students themselves will self-administer a swab. They basically this is not the test that you're maybe familiar with if you've had a COVID test that goes deep. This is in the tip of your nose area, so something that everybody is able to do. A pool, which is generally a classroom, somewhere around 20 students, will do the swab, put it in a vial, the vial gets sealed and gets sent away. And then within 24 to 48 hours, we will get results. And it'll just basically tell us if anybody in that pool has COVID. And then everybody else that is in the pool, will get tested further with a PCR test that we will administer on site at the school, and our nurses will be responsible for doing that. Anybody who comes back negative would be allowed to stay in school. Obviously, anybody who was positive would not be allowed to come back to school. They would be required to isolate. So let's talk a little bit about this at a little deeper level, and that's who needs to isolate in the pool. So if there's a positive in the pool, anybody who is a part of that pool will be tested further. So what we just talked about before. And then for non-participating students, if they're unvaccinated, and this actually should have been for non-participating students and staff, if they were unvaccinated and were determined to be close contacts, they would need to quarantine unless, and this is a change from what we had reviewed with you at the last meeting, these 4 conditions are met. So this would apply only to whether they could stay in school. So it would just be if the contact with the person who was positive was in the classroom and it didn't involve direct physical contact. So that means that there was not, a situation where they were actually, touching each other in, close proximity, and that this is on the school broadly, that masking is strictly enforced. So we would need to determine that in this classroom, the masking was followed, closely at all times. And we have a seating chart that shows that those, that the students meet the requirements for not being considered close contacts. So that's, those are the exceptions. Anybody else who doesn't meet all 4 of these would need to isolate for 10 days. So this was a question that was raised at the last meeting. What would happen to those students who are required to isolate? So this will be treated as an excused absence under our board policy. So this would constitute, a medical reason for not being in school. So that would be excused. Students would receive assignments from the teacher and they'll be responsible for completing that work. Also consistent with current policy, which is our how students make up work when they're absent. So that's the policy that would apply. And, recognizing that there could be, particularly in the beginning, as we have fewer students who are signed up for pooled testing, we will work to define a threshold at which if there's, a significant number of people in the class who are close contacts and therefore need to isolate and aren't allowed to come to school, we will transition to remote learning for that group of students. So very similar to what we did last year whenever we had, a class where the class needed to go into remote. So, something like if more than half of the class needs to isolate, then we will transition to remote learning for the duration of the isolation period. One of the questions that was posed was, what are the assumptions around exposure? And so we have a series of slides that try to explain this a little bit better, and I'm sure that I won't do it justice, and that later on we can come back to it. And Tina is here with us to help with that. And I also believe that we have somebody from Concentric who is also in the audience, and we can promote them to help us to answer any of those questions. So, the recommendation is that testing is given within 5 to 7 days from exposure for anybody who's asymptomatic and unvaccinated. So in the case of a positive pool, a person is actually being tested on what could be their first day of exposure, and that's the day that the test is administered in school. They would be tested again, this time with the Binax test, because somebody in that pool tested positive, and it could have been them. So they will be tested again on the second or third day after exposure. And then again, and I think this is the part that's important for everyone to understand, that what works with this is the regularity. So the fact that you're doing it every week gets you to a second test. So if you had not, because you just had the exposure 2 days before you actually had the Binax test, and you did not have the viral load wasn't high enough to register, you will be tested again within that window of the 7 days from exposure. So you'll have multiple opportunities to be tested. This is fairly detailed from the CDC DOE standard operating procedures about this. And it basically lays out this notion that you are, tested multiple times along the way over the course of the week. And then the cycle starts again. So if you didn't get, picked up on Monday, if you were part of a pool that tested positive, but then you did not register as positive on Wednesday or Thursday, but you actually, as a result of your exposure, did become infected, you may not get caught on Wednesday or Thursday, but you will on the following Monday. And so this is another sort of simplified attempt to show that same thing. One of the questions that we had was whether the vendor, which is Concentric, collects private information. And so I think it's important to, first of all, understand that the only information that they have is the consent information that is being provided by, parents in our case, because of all of our students are minors. So that's, sort of individual student information. They keep that for their records, but that is not at any time connected to the actual swab information. So what they do not have information about the individual students who are in those files. That information is held at the school in a separate database, and that's the one that does identify the 12, 15, 20 students who were in each of those pools. But from the vendor's perspective, they do not have access to that information. And they don't do, at this point, we're not having them do any of our follow-up testing. That's only being done by our staff. So there would not be an occasion for them to actually have any of the information about who tested positive. The only thing that's reported about who tested positive is part of public health reporting, and that's done, by our staff to the Department of Health. So on the vaccination plans, as I mentioned earlier, we're working to continue the work that we started at in the spring when the vaccine became available for students, to have vaccine clinics at our high schools and middle schools for the students who are currently eligible. If that changes and our younger students are eligible for vaccination, we will obviously work with our partners to do that on site as well, so that we can, remove access as a barrier for the vaccine. I know that, there's a lot of questions about the possibility of implementing a vaccine requirement. I would say that alongside the support for for masking, that is probably the thing that you heard the most in the feedback that we've received over the last couple of weeks, is moving forward with some form of a vaccine requirement for staff and also for eligible students. So we're currently in the process of collecting data on staff vaccination rates. So our goal is to have that ahead of the September 8th board meeting. I know that there were questions about previous surveys that we've done, which again, and it's linked in the PowerPoint presentation, and the actual report is included in the board packet. The staff survey that we did in the spring showed that 95% of respondents said that they were either already vaccinated or in the process of getting vaccinated, or would be vaccinated as soon as it was available to them. That was not representative of, that was a self-reported survey, so we don't have specifics of who it was that that responded to that. So it was about 600 respondents, so roughly half of our staff, and we kept some information on where they self-reported to be working, whether it was a school or central department or things along those lines. So in short, we don't have conclusive data. We are now in the process of, finding out for every individual by name, whether they are vaccinated or not. And so we are in the process of rolling that out. Expect to have that information by the September 8th board meeting. The threshold that is considered to sort of necessary to achieve population immunity, as we've seen throughout the pandemic, there's a lot, some organizations are more reluctant to sort of weigh in on this than others. Dr. Gita researched this and came back with the threshold of 70 to 90% of a population being considered the number for population immunity. So, if our original staff survey was representative and 95% of our staff were already vaccinated, then I would say it would be unnecessary for us to implement a vaccine mandate, because we currently have that. We would like to be able to look at this, carefully at the site by the group of employees, to be able to make a data-informed recommendation. So it could be that in some settings we would need a mandate, and others we would already be at population immunity. So our goal is to come back to you on that. The vaccine requirement, if we were to implement it, would in all likelihood need to be negotiated with collective bargaining. May not be that, it's not necessarily that they would need to say like, oh, okay, you can have the vaccine mandate, but it would be impact bargaining. So things like what happens if you're not vaccinated, do you need extra time to go to get the vaccine, who pays for it, or if the alternative to the vaccine is ongoing testing, which is the plan, for example, in the city, would be for, who's going to pay for that testing? Do I need to take time off? Things along those lines. We would have to actually bargain that with our collective bargaining partners. The student vaccines, currently nobody is doing those. The only place that we were able to find was Hawaii, and only for athletes. So, but we all know that it's frequently being done in universities, and that as recently as last week, the vaccine mandate in a public university was legally upheld by the Supreme Court. When we get to questions today, we also have our attorney, Melissa Huey, is here. So Melissa can help us to sort through any questions that you may have on that. So symptoms checks, you've heard this before, but I think it's really important. I know Tina wanted us to emphasize that anyone exhibiting symptoms must stay home. If they come to school symptomatic, at this point, we will send them home, even if they had a recent negative test. So that is the plan, and we will continue to provide testing through Greater Portland Health based on nurse referrals. So we also, there are lots of places where people can go get tested. So this is to remove that barrier, but it's also not the only way that people will get tested. But we want to underscore that it's not going to be, you come to school symptomatic and then you get tested by us, we're going to send you away, we're going to make a referral. So, so that's the symptoms checks. And I just wanted to talk a little bit about remote learning. We talked about this before. We have a process in place. We've extended the deadline, which was originally August 13th, because we wanted to make sure that we did a good job of communicating about this. We received some comments that people didn't know about it. So it's now very visible on our website. It's a banner right at the front of the website. We don't have a firm deadline on it, but we obviously want to do this before the start of the school year. We're grateful to the Press Herald for running a story on it yesterday as well. So we're trying to make sure that anybody who is eligible for this knows about it and can access. Again, very limited reasons for being in Remote Academy. We are prioritizing getting students into in-person instruction. So the reasons really have to be grounded in a verifiable medical need. And so this is where we are in the process. These are the things that we've done and where we are today. We're about to move into the hearing, and then later on tonight, hoping that you will approve this plan for reopening schools. And that's my presentation.
Excellent. Thank you so much, Mr. Superintendent. So just as a reminder, we're about to start a public hearing on our school reopening plan. Then we have some other agenda items to get to. We'll come back and formally consider this plan, starting with board questions. After board questions, there'll be another opportunity for the public to comment on the plan before the board then votes on it. So that is the procedure, and we will go ahead and get started with the public hearing. So tonight we have a lot of attendees, particularly online. I'm grateful to everyone for making the time to join us, and we want to hear from you. But tonight we're going to limit participation to Portland residents or people who have other people outside of Portland who have a direct involvement in the district. So when it is your chance to address the board, please tell us your name, confirm that you either live in Portland or tell us what your direct connection is to the district. Tell us your address, and then we will, I'm going to attempt, this is our first time doing this, so please be patient with me, but I'm going to attempt to alternate between people who want to address us in person and then online. We have a lot more people online, but we will start with that alternating back and forth. If you are on Zoom and you want to participate, please indicate that by using the raise your hand feature. You can find it either at the bottom of the Zoom window or next to your participant name. And with that, we'll begin. So just as a reminder, each speaker will have 3 minutes to address the board. Is there anyone in person who would like to address the board? You can come right up to the mic. So again, let us know if you're or confirm that you're a Portland resident or that what your direct involvement in the district is. Tell us your name, your address, and then you have 3 minutes to address the board.
Yeah. Can you hear me?
Yes.
Hi, everyone. My name is Dr. Beth Rabbit. I live in Portland at 103 Roaring Brook Road, and I have 2 children enrolled at Forsythe Elementary School. I also lead a national education nonprofit that's been working with hundreds of school districts throughout the pandemic to support remote learning and safer school reentry. Specifically on the latter point with a team from Harvard at Ariadne Labs, trying to translate CDC guidance to tools for schools that are seeking to reopen safely. I come tonight just to offer general support for the plans as laid out. I'm a strong proponent of universal masking for every adult and child in school buildings. And I do want to express appreciation for the continued use of protocols around personal and physical hygiene, ventilation, use of outdoor spaces. I, however, have a couple of major deficiencies that I saw in the plan that I wanted to raise. I'm going to try to integrate what I did learn tonight, so I'm not being redundant. First off, we know from the emerging science and the hard-won work of school systems like Portland last year that adopting a layered strategy to preventing transmission is definitely the way to go to get as many of our learners in person as quickly as possible. At the same time, I did want to express some concern about the reduction of cohorting or social distancing as a strategy for our students. I understand, appreciate the attempt to bring in pooled testing. Pooled testing is primarily a blunt strategy for transmission that's already happening in a building as it relates to infection and illness. Pooled testing really doesn't work unless we can actually maintain the boundaries in which we're actually pooling students and actually controlling the degree to which kids are actually distancing from each other socially, meaning we can tell that the boundaries of a pool are actually safe. Unless we're keeping kids in classrooms, particularly at the K-6 level, pooled testing is more performative than a helpful strategy for actually preventing risk. Masking, physical distancing, cohorting, hygiene, ventilation are our strongest strategies as it relate to what is happening in classrooms with kids. And I think we really need to get stronger in our approach to making sure that those boundaries of the classroom are respected. And so that when infection does happen, we can actually quarantine the right kids at the right time and the right staff at the right time. Secondly, I have, as a parent, have actually never gotten to go into Forsythe Elementary. I understand the desire to be able to open up our buildings, but candidly, this is not the time to have potentially unvaccinated adults coming from a variety of environments entering buildings to make us feel good. We should be waiting until our K-6 students have the opportunity to be vaccinated and that we reach higher level vaccinations before allowing other individuals in the school building during the school day. I'm appreciative of the comments about not actually, potentially using buildings for other reasons after. Finally, I just need to raise the issue of the lack of any plan for continuity of learning for kids when they're out of school. Our kids deserve remote learning.
Do you need an extension? Okay.
Yes, I'd love that.
Okay, I'll give you another 3 minutes.
Awesome. Sorry, I had 6. I thought I had 6 when I prepared. The values of equity and agility would say that we have to support our learners wherever they are. Supporting our learners does not mean sending home worksheet packets. It means maintaining relationships with adults, using the technology that the system invested in last year to provide effective, enriching, and achievement-oriented instruction daily to students wherever they are. So it's concerning to me to see in the reopening plan really no expression of training for staff or any plan for really meaningful continuity of learning for students who will be leaving to quarantine, which, because we know of rising rates of pediatric and breakthrough cases, as well as our plans to test and quarantine routinely, they're just going to happen. So if we want to reach every kid, particularly those kids who might be in environments where they're not getting a ton of at-home enrichment opportunities, you might have parents who can oversee learning on packets, we've got to have a stronger plan. Thank you.
Thank you so much. Okay, now we are going to move to our first online participant, and we're going to start with Emily Connolly. Emily, you are unmuted and you have 3 minutes to address the beginning.
Thank you. Hi, my name is Emily Connolly. I live in Portland at 80 Bartley Avenue, and I have 2 children entering elementary school at Lyseth this year. I'm concerned that all of our elementary school aged children who haven't been able to be vaccinated are at high risk of exposure to the extremely contagious Delta variant of COVID-19, and that the push to have in-person schooling is dangerous to them. I know very well that remote learning isn't ideal after a year of doing remote first grade, but that option did let my family know we were doing everything we could to protect our kids from exposure to COVID. I do wish that were an option this year, since our kids still aren't vaccinated and cases are the way they are. I am glad that masking will be required because that is a bare minimum measure to take to prevent transmission in school. It's horrifying seeing the skyrocketing pediatric case numbers in states across the South where schools have reopened without masks, and we know we need to avoid that. I do know that many of the measures taken last year helped keep schools open, but I think a lot of the decisions being made about this school year are kind of based on last year's data when we had a much less transmissible variant and fewer kids in schools. I was wondering if there are data on transmission rates in schools that are requiring students to wear masks from this year that you're using to make the decision to open schools, or is this kind of an experiment? I'm glad to hear the district will use pooled testing. I am concerned that testing once a week won't be frequent enough. I'm not sure how much transmission is possible in the time period between the initial test and isolating positive people. And I'm surprised to hear it's only starting several weeks into the school year. I would hope the district will require teachers and staff to be vaccinated if needed. Even though none of the younger students can be, it would help to have adults in the building be vaccinated. Eating lunch was addressed in the presentation, and I was wondering if families will be able to know specifically how their kids will be eating and what the risks are. Right now, masks are not required when students are playing outside, and that might have worked last year, but with this variant, it does seem like even children playing outside on a playground can transmit to one another. And I was wondering if you'd consider requiring masks outside. Last year, smaller class sizes were one of the helpful mitigation steps taken to prevent the spread of COVID when we had an earlier and less transmissible variant. And I was wondering if classes could be smaller this year as well to decrease the risk, and if the schools will avoid large indoor gatherings of students like assemblies and sports events. And we know that ventilation can make a big difference to help decrease transmission. And I was wondering if families would be able to get more information on what schools are doing in specific classrooms and where their students will be, and if there will be testing for indoor air quality. I was wondering if teachers and staff will be able to get paid time off if they're sick or quarantining. Yeah?
That's the end of your time.
Okay. Could I have 30 more seconds?
Yes, I should have done this before and I forgot, but is there a motion to extend Emily's time? I see, yes, there's a motion. All in support? Okay. Emily, go ahead. You have 3 more minutes.
Thank you. I was wondering if teachers and staff will be able to get paid time off if they're sick or quarantined, and if there's plenty of support staff able to step in when needed, and if teachers and staff will get hazard pay in these conditions. I was also wondering at what point schools and or classrooms will close down and switch to remote if needed. Going into the school year, it would be helpful for me to know, what number of cases or clusters it will take, and if there's a plan for switching to virtual learning and how students will be supported in that. Thank you for hearing all of my concerns. I'm done.
Thank you so much, Emily. Okay, next we have Erika Ball, and Erika, Greg, I'm not allowed to, I don't have access now to allow Erika to speak. Could you allow Erika to speak, please?
Yes.
Thank you. Erika, you have 3 minutes to address the board. Please start with your name and address.
Hello, my name is Erika Forsythe, and I'm a Portland resident at 85 Curtis Road, which is in the Lyseth catchment area. My oldest was supposed to begin kindergarten this fall at Lyseth. I will not be sending my child to school this fall until they are able to be vaccinated, as I do not believe there are sufficient measures to prevent the transmission of COVID being implemented within the schools. I would like to know what the board's plan is for the possibility of a vaccine mandate once the emergency use authorization is approved for the 5 to 11-year-olds. And what a timeline would be for implementing a mandatory vaccination policy within the Portland School District. Thank you.
Thank you so much, Erika. I really appreciate your participation. Next, we are going to hear from Bianca Winship. Bianca, you have 3 minutes to address the board.
Hi, this is actually Ken Winship here, Bianca Winship's husband. We live at 78 Allen Avenue Extension. We have 2 kids in elementary school, as well as my wife is a teacher at Roe. I just wanted to let Superintendent Botana, as well as everybody within the Portland School District that works within the district, know that we think you've been doing a fantastic job. We appreciate your efforts. That being said, I also want to agree with the first several commentators, and I want to just push a question on the vaccination requirements. Last Thursday, the National Education Association, the largest teachers union in the United States, endorsed a COVID-19 vaccination requirement for school workers. And I think that may add to the legal case for mandating vaccinations. And I also have the question, has there been any conversation to date with the teachers union about this? I know teachers unions and teachers from different parts of the country, and it's really a mixed bag where the union comes down. Given the criticality of this, I'm wondering if there's been preliminary conversations yet. And I would encourage, in the event that those conversations occur, that any vaccine mandate would extend to booster shots going forward. That's all I have. Thank you.
Thank you so much, Ken. Next, we're going to hear from Hopkinson. Hopkinson, you have 3 minutes to address the board.
Good evening. My name is David Hopkinson. I live at 9 Grafton Street. I have 2 children, one at Presumpscott and one entering Lyman Moore. I will echo the comments of the gentleman before me and just say very happy with the job that you all have been doing. I know how hard the work has been. A couple of comments that I do have. 100%, my kids are going back to school in person. I enjoy the mask mandate. I know you've been doing a nice job with getting kids outside as much as possible. One particular piece of information that was given tonight spoke about herd immunity with in the 95% of respondents thing. I think we need to be very careful when we talk about herd immunity. Herd is something that stays together. It's difficult to take herd immunity from one particular place and then allow that herd to disperse to its own herd and come back to a herd. A herd within a herd. I know it's ridiculous. It's also weird not being able to see you guys any longer, but whatever. I want to make sure that this Zoom/in-person thing that's going on because of this pandemic is something that remains after the pandemic. So I wanted to tell you that as well. It's kind of something I've been looking forward to for a while, so this is phenomenal. Finally, some of you probably knew you were going to hear this from me. However, we are in a respiratory pandemic. We are not teaching children how to use their respiratory system properly. Nasal breathing can mitigate substantial amounts of items coming in and out of your body. We also need to teach children the prerequisites for health and allow them the ability to use them. I happen to have a skin rash right now. What did I do? I learned about my skin and the rash and what happened. I would guess that if you asked the average sixth grader what the coronavirus was, how it was spread, and what it truly is, they may not have an answer, and they may not know ways to mitigate it. As I've mentioned before, and I'm sure my time is starting to run out, so bear with me, these same types of practices can be used to help control stress, anxiety, and mental health within children. Having two children that were remote, now returning to school, there are obviously mental health type, I don't know what word I want to use, stress and anxiety over going back to school. And I'm looking forward to what the superintendent and the board has for plans as far as helping those children mentally transition. And I bet I'm at about 3 minutes, so I'll stop there and talk later if I need to. Thank you, guys. Awesome job.
Thank you so much, David. I'm going to try and stop my alarm. My apologies. Okay, next we're going to hear from Bill Weber. Bill, you have 3 minutes to address the board.
Thank you, Chair. Superintendent Bontana and members of the Portland School Board, my name is Bill Weber and I live on Roaring Brook Road in Portland. Appreciate the opportunity to speak tonight, and I certainly appreciate the work that the Portland school staff has put into the proposed reopening plan, and I'm generally in favor of the need for universal masking of students and staff when indoors. However, I think there are several weak points in the plan that I would like to focus on in my remarks. In developing a plan to prevent the spread of the coronavirus, we must recognize that we are in a dynamic situation where previous measures to defeat the virus may no longer be sufficient in facing the new variants of the virus. Last month or two, the goal was to reach a 70% vaccination rate to gain herd immunity, but a 90% vaccination rate is now being required to prevent the spread of the more infectious Delta variant. Doing only the minimum recommended will not be sufficient to stop the virus. I believe that additional measures must be taken to give us more of an advantage over the Delta variant and other new variants as we start back to school. Potential areas where the plan could be strengthened. Number one, I now understand that the plan does require all staff to wear masks, whether they are vaccinated or not. And I think that's a very good point to change to make. Number two, masks need to be highly effective. Either N95 or double masking should be required. Disposable surgical masks could be issued to each student to be worn under the student's cloth mask. If students and their families are to take masking seriously, then we need to materially show our support. Number three, mandatory vaccination of staff and students should be a priority. I don't think anyone can envision loosening mask requirements in the future without a fully vaccinated staff and student body. As Portland City workers will soon be required to be vaccinated, it only follows that school teachers and staff should also be vaccinated. Discussions with the teachers unit and union and the DOE should be prioritized to gain their approval. In summary, we have two proven and effective means to mitigate the spread of the novel coronavirus in our schools. One, masking with social distancing, and two, vaccination of staff and students. This isn't an either-or situation. We must do both, as they work in tandem to prevent the spread of the virus and minimize serious health consequences. Deploying one measure without the others is like trying to fight with one hand tied behind your back. Our priority must be to keep our schools open, and to do that, we need to do everything we practically can to prevent the spread of the virus. I hope you will consider the above measures in approving the superintendent's plan. Thank you.
Thank you so much, Bill. Now we're going to move to Krista Vo. Krista, you have 3 minutes to address the board.
What do you think?
Thank you. My name is Krista Vo. I live at 308 Danforth Street, and I'm a parent of 3 Reiki kids and one who is moving on to King Middle School. I just want to express my concern that we're starting school in person without having the pooled testing be ready. I think that I'm not alone in relying on that as a important safety measure for me to feel comfortable with my kids returning with without distancing and with potentially a larger number of students participating in person. I am very thankful that masks are going to be required, as I think that's also an important safety measure until everyone can be vaccinated, and probably longer than that with the Delta variant around. I also want to express some concern about what I see planned for those who opt out of pooled testing. I think that it's likely that there will be some disparate impact to people who are participating in school while also having a disability and maybe not able to withstand pooled testing, even though I understand it's a gentler form of self-swab. However, if your child has an IEP or a 504 plan and the school is not going to be providing any kind of assistance with the assignments that are going to be due during those 2 weeks, it just seems like it may have a disparate impact on certain groups. So I hope that that is something that's considered as this plan moves forward. And I just want to express that I, once again, kind of like last summer, feel like we're getting a lot of information last minute and having to make a rush decision. And it feels like it's a challenge to make an informed decision at all this year, because even what we've been told up until now seems to be being changed, and now maybe pooled testing won't be happening right away. So anyway, I think you're all doing a great job, and I know that we are still in a weird situation, and I thank you.
Thank you so much, Krista. I just want to make sure that there isn't a member of the public in person who wants to address the board. If there is, let me know. And if that changes throughout the public hearing, just give me a wave and I'll see you and work you into the public comments. So next we're going to move to Rosie. Rosie, you are unmuted and you have 3 minutes to address the board.
Okay, thank you. Can you hear me?
Rosie, we cannot hear you that well, so if there's a way that you can speak more directly into the mic, that would be helpful.
Okay, sorry, can you hear me now?
Yes, that's better.
Okay. My name is Rosie Lenahan. I live at 120 Noyes Street in Portland. I have a child at Ocean Avenue and a child starting at King. I'm just speaking in support of the plan. And also just want to take the opportunity to thank all of you for your work over the last 18 months. I think Portland has done an amazing job. My husband and I are educators in nearby districts. And, you know, we feel really fortunate that our kids are in Portland. We think you guys have really done the work to make our schools safe. So I'm confident that this plan will continue in that vein. With family and friends in other parts of the country starting school this week, where masks are not required, I'm just grateful that Portland is requiring masks for everyone. I think it makes things a lot more clear and easy. And we've lived with masks. We can do it. The kids can do it really well. So, yeah, I just want to say thank you and appreciate the work, and hope that the first few weeks of school prove that this plan is keeping everyone safe. And I trust that if we need to pivot, Portland will do that, you know, right away. So thank you.
Thank you so much, Rosie. Appreciate it. Okay, next we're going to move to Tiffany Bond. All right. Tiffany, you are unmuted and you have 3 minutes to address the board. Tiffany, are you there? Okay, it looks like we lost Tiffany. We'll keep my eye out. Tiffany, if you want to speak and we just lost you, just raise your hand again and I'll move you right to the front of the queue. That said, there's no one else who has their hand up to speak at this time. So if there's any other member of the public who would like to speak, please use the raise your hand feature in Zoom, which is at the bottom of the Zoom webinar or next to your name. And I see Tiffany. So Tiffany, I have unmuted you and you have 3 minutes. But we cannot hear you.
Can the folks on Zoom hear?
Can folks on Zoom hear Tiffany?
No, we cannot.
Okay.
Go to John then.
Tiffany, I'm going to go to our next speaker, and maybe if there's another way that you can, a different device you can use or another way to call in, please do so. And again, I'll look for your name right away. Okay, now we are going to move to John Thibodeau. John, you have 3 minutes to address the board.
Thank you. Can you hear me okay?
Yes.
All right, thank you. John Thibodeau. I live at 114 Clinton Street in Portland, and I'm speaking for equity in Portland schools. Echoing a lot of what's been said tonight. Thank you so much, Superintendent and school board members. I've been paying attention to what's happening across the country, and it's hard to watch. And I feel a lot of pride in hearing the seriousness and all of the hard work that you're doing. So I greatly appreciate it. A few thoughts. I guess I'll just kind of take through a few different issues that I would like to just emphasize, and then I'll just have a couple of comments. I would concur with one of the earlier speakers about unvaccinated adults entering the building. I think that's significant and maybe something to reconsider. Also, wearing masks outdoors, I think also is important with kids. Let's see. I appreciate the universal masking and the pool testing. I am curious why there is an opt-out for the pool testing, and I do wonder if that might undermine the ability to actually gauge what's happening. Let's see. Okay, I think that was it. And I guess the main point that I want to try to convey is that the earth is shifting beneath our feet here. And so we're trying to understand what's happening. And I think the two best examples of countries that are going through a similar situation are Israel and United Kingdom. And in Israel, I think they're looking at now about 50% of their cases are now breakthrough cases. Pfizer effectiveness has gone from about 95% to 64% as of late July. So vaccinating is our greatest weapon, and it still, I think, is close to 90% in Israel as far as mitigating serious illness or death. But people are now getting it often who are vaccinated. And so with a large population that's unvaccinated, are the children, we have to do everything we can as adults to make sure, because even those that are vaccinated are still going to get positive tests and they're still going to be able to pass it on to kids. So we have to be so vigilant, I believe, because we're only still at our best 64% effective in stopping positive tests. And as far as herd immunity, I think we need to stop using that language at this point. With breakthrough cases, there isn't going to be herd immunity. I think will be a term of the past, at least for the foreseeable future. one other thing about the masking too is the quality of masks. And I don't know if I've heard any discussion about looking at resources to ensure that.
John, you've reached the end of your time. Do you want an extension?
Yeah, just 30 seconds would be great.
Is there a motion to give John an additional 30 seconds? I see Mr. Irish, seconded by Ms. Bondo, and all in favor? All right, John, you have 30 more seconds.
Great, thank you. I know the state of Utah is, and I know that's a state situation, but they are purchasing K95 masks for students and I believe staff. And so I wonder if that's something the board has considered as well. Low quality masks are helpful. They're better than none, but they're really inferior to high quality masks. And again, we're going to be looking at an ever evolving situation that's probably going to be getting worse as we go into the winter. So I think we need to look ahead and be as vigilant as possible. So thank you for all of your work.
Thanks so much, John. Okay, next we are going to try to hear from Tiffany again. So Tiffany, you are unmuted and the floor is yours. You have 3 minutes.
Can you hear me this time?
Yes, we can hear you. Thank you for your
sorry.
patience.
Exit and come back. So my name is Tiffany Bond. I live at 3 Colonial Road. I have 2 children that are enrolled at Roe. I cannot even tell you how much I want my children in person this year, though I don't think that is going to happen. Last year, my children were in remote academy. We made that decision based on 4 factors. I didn't think the district properly weighed the risk to the teachers. We needed to keep our kids safe. We had the capacity to do homeschooling because I do work from home, and I figured it was my responsibility to help reduce those class sizes, as another commenter mentioned. And for scheduling, it is, for any parents who are working, it is an absolute freaking nightmare to try to figure out how to do scheduling if you don't know if your kids are going to have a week or 2 weeks when they can't be in school and when they must be remote. So for continuity, that was a wiser choice for us. The other speakers have covered most of my in-person concerns, although I haven't heard much about ventilation. And I know at Roe, though it is a fairly new facility, when we were doing the walkthrough when they just opened, the first thing I commented on with the party that I was traveling with me is, oh my goodness, there is just no ventilation in this building. It was stuffy. And for a new building, that was not great. I'm concerned that we haven't mitigated or addressed ventilation. I'm also deeply concerned, and I think one of the other parents mentioned this has not been a particularly transparent or plannable process this year. The website is full of data from fall of 2020. That doesn't help us for planning for this year. The process for going remote is not clear, and it shouldn't be limited to medical. And I'm speaking not just for myself here, I'm a family law attorney, and many of my families are very concerned and very worried about the safety of their children before vaccination, and also other issues like scheduling and trying to make sure they can be prepared and have a plan. And it's not easy to do that with what the district has made available. So we should have the remote option. We should have remote academy for our children until there is a vaccine available. Parents who feel comfortable and want to send their children to school in person should be able to do that. The district is certainly doing what they can to mitigate, but parents who feel unsafe sending their children or who cannot handle the unpredictability of likely closures should have the ability to have continuity of education with remote academy. It's for the health of our children. It's for the health of our whole community. And we need to be able to have those continuities available. Thank you.
Thank you, Tiffany. Now we're going to hear from Tederico Creative. You have 3 minutes to address the board. Please go ahead.
Hi, thank you. I didn't know how to rename myself, and I also obviously didn't know how to remove that picture. But this is actually Jennifer Boggs, B-O-G-G-S. I am the parent of a 6th grader who's going to start at Lincoln Middle, and I live at Edgeworth Avenue.
Sorry to interrupt you. Would you repeat your name? We just couldn't hear you.
Oh, sure. It's Jennifer Boggs, B-O-G-G-S.
Thank you so much, Jennifer.
And I live at Edgeworth Avenue. And I just had a few things to say. One, I guess the most concerned in terms of the mitigation about ventilation and air quality. And I'm just asking that you make it a little bit easier or a lot of bit easier for parents to understand what is happening with the individual schools and the classrooms that our kids will be in. I know that there's a spreadsheet and you have to have known that there was a spreadsheet, and I actually don't remember where I can find the spreadsheet. So if you could make that more easily attainable, that would be wonderful. Also, another couple of parents had mentioned continuity of learning, and I'm also concerned about this, especially considering all the remediation that will probably have to be done this year because of 1.5 years of the pandemic. And finally, I'm also wondering if pool testing couldn't start a little earlier. I appreciated what the first parent, who is also a doctor, had to say about the blunt instrument. So I am wondering if we couldn't start that blunt instrument a bit sooner. So those are my comments for now. And I just finally want to say thank you to the superintendent and the administration and the staff and the board. It has been a really hard time, really, really hard time. And I feel like all we've done is pivot. And so I do appreciate your efforts and especially the teachers' efforts to continue to pivot and pivot and pivot. So thank you so much. And I'm done.
Thank you, Jennifer. And since multiple speakers have raised it, I just put in the chat the link to the document that goes school by school, classroom by classroom, specifying the steps we've taken regarding ventilation. Okay, next we are going to move to Julia Duffy. Julia, you are unmuted and you have 3 minutes to address the board.
Hi, my name's Julia. Can you hear me?
Yes.
Yes, okay. My name is Julia Duffy. I am a Portland resident and I live on Arlington Street. I do not have any children in the school district, but I do know multiple people within our community who are immune compromised. And I also know multiple people who are, after 1.5 years still struggling from the effects of long COVID, which I don't think is being talked about enough in terms of people's impacts and the trauma that has occurred over the past year. And especially, as somebody mentioned, a lot of children not fully understanding what COVID is, what the impacts are. They know that we are going through something horrendous globally, but they don't really have an understanding of what's happening and why their parents and their friends are so scared, and why it's been so polarized politically. I think their ability to feel safe and confident in making their own decisions has really been undermined. And I think that from an equity standpoint, the option to be a remote should not be limited to medical, like somebody else was saying. I think that there are so many different reasons why people benefit from having the option to stay at home, whether it's them being immune compromised or for their mental health or just the protection of other people in their community. I think we have a really long way to go before we actually have the ability to keep Portland at large safe. And having worked with the public, I worked at a location in the mall and seeing how children act when their parents aren't around and how parents act whether their kids are around or not, just the polarity between masking or not masking, vaccines or anti-vax. I just think there's still way too many question marks in our community for going back to school being mandatory unless it's a medical exemption. I just think the past few years have really been about equity and hearing from other communities and really seeing the disability community and how people of color are impacted at higher rates. And I want to make sure that equity is brought into the conversation when making these decisions and giving people access to learning environments that benefit them outside of just their physical health. That's it. Thank you.
Thank you so much, Julia. Next, we're going to hear from Rachel Pargetter. Rachel, you are unmuted and you have 3 minutes to address the board.
Hi, can you hear me?
Not great. If there's any way to speak more directly into the microphone, that would be helpful.
Great. Is this better?
Yes, it is. Thank you.
Okay, great. Thank you. I apologize to everyone in advance. I just joined the meeting late, so I have not heard all of the parent comments. I too am concerned about ventilation. And I can only speak to the high schools because I only have a high schooler at this point. I did look through it, and my daughter goes to Portland High, and there is one restroom in Portland High for student use that has been remediated to adequate ventilation. I'm very concerned about that with Delta, and the fact that it can be transmitted in as little as 15 seconds if a person removes their mask. And I don't know if people are aware of this, but the juuling and e-cigarettes are endemic at the high schools and all over the place. And I'm very worried about students removing their masks in the bathroom to use e-cigarettes. So I'm really hoping that will be remediated in all the high schools. And I know that there are ventilation issues at Adhering as well. And for the parents that have kids that can't be immunized, my daughter is fully immunized. I would be terrified of sending my kid back if they couldn't be immunized, and would also want to be able to do remote school with or without a medical exception. So I just wanted to add that in there. I would like to have the option for my family based on our family's needs as opposed to just a medical reason. My daughter actually did great with remote school most of last year, the one who's going into junior year, but she wants to go back. I'm just worried that things went very well last year at the high school level when most of the students weren't there, and that when students go back, the building and the facilities are going to be overwhelmed on the ventilation front. So I apologize. I just wanted to bring up the high school point of view. Thank you very much to the board and the superintendent and central office for doing your best, and all the staff for doing your best in these difficult times.
Thank you so much, Rachel. Next, we're going to hear from Sam. Greg, it doesn't look like I have the ability to unmute Sam. If you could go ahead and do that. Oh, now I can do it. All right, Sam, you have 3 minutes to address the board. Please go ahead.
Hi, can you hear me?
Yes.
My name is Sam Hytov. I live on Brook Road in Portland. I have a son who will be going to Lyseth for the first year as a 5th grader. And I understand that everything is evolving and currently changing and constantly being updated, but I've been on the school board's website looking for information, and it is sorely lacking in details and information on what this year is going to look like. And I find it hard to understand how a vote can be made when we're just learning about things tonight. And I also am very, very, very concerned with mental health for the children, especially for our youngest kids. I think not being able to engage in each other normally has had a severe impact on their mental health, and I would like to know what the school is planning on doing for them. That's all. Thank you.
Sam, thank you so much for your comments tonight. Next, we're going to hear from Teresa Kim. Teresa, you are unmuted and you have 3 minutes to address the board.
Hi, I just want to say thank you to everyone for allowing me to speak, and I appreciate all of you and everything that's going on. As a mother, having a middle schooler going into King Middle School, I'm very wary. And the only reason I say that is because last year we literally had cases 2 to 3 times a week. And that scares me as well as my children, because I do have children at home who are underage and cannot be immunized at this time. So I have a lot of questions on how that's going to be handled. My other thing is that my son would prefer to have remote learning for a couple of reasons. Number one, he's scared to go back to school. Number two, he's scared he's going to bring a virus home to his brother and sister. And the other side is that he has severe case of ADHD. And even with medication, he's still consistently touching his face, wanting to take his mask off. So I would like to know how that's going to be handled as well. Thank you.
Thank you. And Teresa, would you mind giving us your address?
Yeah, I'm on 165 Pearl Street, Portland.
Thank you so much. Thank you for addressing the board tonight. Next, we're going to hear from Colin Phillips. Colin, you're unmuted and you have 3 minutes to address the board.
Hi, thank you very much. Colin Phillips here.
Colin, sorry to interrupt you. If there's a way to speak more directly into the mic, please do.
Is this any better?
Yes.
Hi, Colin Phillips here. I have a rising first grader and live on Vaughan Street. We're obviously very excited about our daughter going to school in person, But I think echoing some of the sentiments from the other speakers have hesitation as well. I'm a healthcare worker on the front lines and have been with the virus now for 18 months and wanted to emphasize a couple of things that make the job a little easier and what makes me encouraged with what you in the school system are doing. And it's been said before, but masking is critical. We're intending on sending our daughter to school with a KN95 mask. And if that's not possible, doing double masking. And I just wanted to reemphasize that that's what works in the hospital. And it's been proven scientifically that the N95 mask forms a better barrier than the surgical masks, even with modifications. Additionally, I just want to emphasize the importance of vaccines. We are eagerly awaiting the opportunity to vaccinate our daughter against this, as we've done with the flu, MMR, and every other communicable disease that we can. The final point that I want to make is the point of trust. This is a scary time, and truly there's a certain amount of trust that we need to have both with you as a school board in keeping the safety of all the children at heart. And you are earning our trust from both this public forum and from what I've seen and the efforts that you guys are all making. I am impressed with the group testing. Additionally, just the trust amongst the community. At work, we have to do our symptom checkers and make sure that we're not coming to work sick. And obviously this disease is difficult with pre-symptomatic spread, but certainly if you are symptomatic, having the trust amongst the community that we're all keeping each other's health in view is important. So thank you for earning our trust. Thank you all for what you're doing. And I yield the rest of my time.
Colin, thank you so much for your comments tonight. Next, we're going to move to Anna Fink. Anna, you have 3 minutes to address the board.
Thank you, Emily. Can you hear me?
Yes.
Thank you. First, thank you to everyone at the central office and in all the school buildings who has been, as Colin said, earning our trust over the last 18 months. I feel a lot more comfortable than I expected to at this point, looking a couple weeks down the road to school starting. At the same time, I believe that now is the time to take all the steps we can, particularly with Delta in our midst, even taking those extra steps. So while it is tempting to give the kids that opportunity to take off their masks outside, I think that's a step that we should keep. It's sort of the time to be operating out of an abundance of caution. I think there are a number of things like that. And in that same category, I would encourage not having unvaccinated adults, unless they're used for medical reasons, not having extra adults or unvaccinated adults in the class, in the school buildings. I would encourage starting when we can do testing and starting with testing as many kids as we can. This is when everyone is coming from day camps and summer camps and being coming from all over and coming into our school buildings. I would encourage requiring vaccination when it's available. And again, distancing and ventilation as much as we can and whenever possible. I missed the beginning of the presentation, so if there is a way to share the document, that would be really helpful. One of my big concerns is around lunches and how kids will be distanced during that time, because I think that is one of the most has the greatest potential for spread during the school day. So thank you for all that you are doing. Thank you for considering these comments, and I look forward when we can all breathe easy again.
Thank you so much, Anna. Next, we're going to hear from Katie Diamond Falk. Katie, you have 3 minutes to address the board. Go ahead. And please, just as a reminder, start with your name and address.
Hi, I'm Katie Diamond Falk. I live at 100 Longview Drive here in Portland and have children at Lyseth and Lyman Moore. And I have a child who would have been a kindergartner that I've chosen to keep in pre-K for this year, which relates to some of my question. I will also give the background that I'm a physician myself. So my questions for the board include that related to some of the issues related to the difficulties with education over the past year and anticipated for the coming year. My children are amazing maskers who mask outdoors still with their friends at this point, 99% of the time. And yet we had 6 quarantines for my family alone last year. And so my question is, what is the plan for catch-up education or even potential repeating of grades based on the pandemic and the circumstances that we cannot control? And how would eligibility be determined for additional support or grade repeats to be determined? My next question is related to the challenges of testing. And I appreciate the ideas of pooled testing and the follow-up by next testing. And yet, as a physician, I can get rapid testing, but struggle to get it for my children last year. And so I'm wondering how Portland Public Schools will help ensure adequate access and rapid turnaround of PCR testing as there is increased demand for testing. That often, if I test my children, if they have a runny nose before sending them back, how do I get a PCR test that doesn't keep them out of school for an additional 5 to 7 days because of how long the turnaround time could be? And then, will there be any required documentation for results if a patient, clearly the other side of my brain, if a child is sent home with symptoms? And what would that look like in terms of the responsibility to track that? And then the last piece is 2 things. Masking outside, I feel like this should be a part of the expectations. I saw photos of my children during the school day from their amazing teachers, but during their outdoor time with not social distancing with their friends and not wearing masks at times. And this was something that I've been really clear with my own children that they will not be going to school if they are not masking outdoors. And then the last piece is with pooled testing, where will the teachers and administrative staff be included within the pooled testing for things like the specials for the librarian? How will those pieces be incorporated and be able to share back to the larger community? Thank you.
Thank you so much, Katie. All right. We don't have any other hands up, nor do we have anyone else in person who looks like they want to speak to the board tonight. Just to reiterate, there will be another opportunity for the public to comment on the school reopening plan later in the evening after the board has an opportunity to ask questions and prior to the board's vote on the plan. But is there anyone else who would like to address the board specifically on our reopening plan at this moment? If so, please indicate by using the raise your hand feature in Zoom. I see we have one person with your hand up. So Jamie, we are going to go to you. Please begin by stating your name and letting us know what your address is and confirming that you are a Portland resident or have a direct connection to the school district. You are unmuted and you have 3 minutes.
Jamie Hamlin, Pembroke Street, Lyseth, Lyman Moore parent. My kids were in remote academy last year. We're intending to send both of our school-age students back this year to 5th and 7th grade. One of my children is immunosuppressed. It's not without a severe amount of trepidation that we intend to send her to her first year of middle school. Under the circumstances, I'm disappointed in the decision to not mask outdoors. What that, in effect, facilitates is a dangerous environment for my immunosuppressed child. in which she can either choose to engage and be socially distinct while engaging and still at risk, or in which she will need to remove herself and also consequently be socially isolated. I'd also like further thinking to go into lunchtime, similar risk factors, similar not only viral risks, but also risks for social isolation for children who are either at higher risk themselves or are required or inclined to take further measures to protect themselves because they have family members who are at higher risk. So I strongly urge that further thinking go into lunchtime and that masks be required at all times outdoors. And I also strongly urge that all teachers be required to be vaccinated unless they have medical reasons that would exempt them from being able to get a vaccine. It's just one more vector which we ought to eliminate to protect our children, particularly our immunocompromised children in the schools. Thank you.
Thank you so much, Jamie. So with that, I'm going to close public comment. We don't have any additional hands up. Again, there'll be another opportunity later in the meeting. I want to just take the opportunity to thank everyone for participating tonight. It is incredibly valuable to hear your input and feedback and suggestions. So thank you for making the time and being with us tonight, and for your very good feedback. Next, we are going to move to another public hearing, or just public comment opportunity, I should say. This is on items that are not on tonight's agenda, specifically items that we're not voting on tonight. So if there's anyone who would like to address the board on issues that aren't on our agenda that we're not voting on tonight, please indicate so. Either let it, for those of you in person, let us know. And if you're on Zoom, use the raise your hand feature. And we're going to start with David Hopkinson. David, I am going to unmute you and you have 3 minutes to address the board. Go ahead.
I am so sorry. This is David Hopkinson, 9 Grafton Street, 2 children in the Portland Public Schools. I just want to, it's a question, you can answer it or not. This comment on anything not on the agenda, is this a recurring thing now? Thank you very much. I'm done.
Thanks, David. We don't typically respond to questions like this, but I'm going to take this opportunity because I so want the public to participate in our meetings at every opportunity. And this is something we changed within the last 6 or 9 months, where rather than having a generic public comment period at the end of our meeting, we now start our meetings with a public comment opportunity for issues specifically that we're not voting on that at that meeting. So yes, we are starting every meeting with an opportunity for the public to weigh in on any issue that you want to talk with us about. And then, of course, as we go through our agenda, if we're going to vote on the issue, on a given issue, there'll be a specific opportunity to comment for the public to comment on that issue. Okay, so I do not see any additional hands up, so I'm going to close public comment and we are going to move on to the report of the chair. I had a very quick couple of things I wanted to say, and it started with a theme that I really heard tonight, which is about how this pandemic is continuing to evolve, and as a community, we're all in this together. And I am both grateful for that and cognizant of the responsibility that brings us. And I want to urge us all to have patience and grace and work as a community to continue to ensure that our students are learning and that our students and staff and community is safe as the pandemic evolves. And then I just wanted to welcome everyone to the 2021-2022 school year. I know in my household, we have kids that are bugging me to go to do back to school shopping. I think that it feels like school is starting soon and excitement's in the air. And I want to welcome everyone to the new school year. So with that, I'm going to turn to the superintendent, and we're going to start with his report. Superintendent Botana.
Thank you, Madam Chair. I also want to point out that we will resume student reports at the September 9th board meeting when school restarts. Portland Public Schools recognizes the original inhabitants of the land on which our city and schools stand, the Wolastoqiyik, Micmac, Penobscot, and Passamaquoddy tribes, known collectively as the Wabanaki Confederacy or people of the Dawnland. We're honored to have Wabanaki children among our students today. And as a district, we're committed to making the past, present, and future of Wabanaki peoples visible in our schools and classrooms. As you heard from Chair Figdor, it's time to welcome everybody back. To our staff, students, and families, happy return to school. When we meet again, we will be in our second week of in-person learning in the Portland Public Schools. And I would like to remind all families that school begins on August 31st for students in grades 1st through 12 and September 2nd for pre-kindergarten and kindergarten students. I also want to remind everyone that we have new start times for our schools. Our elementary schools, Ocean Avenue, Longfellow, East End, and Talbot, will start at 7:40 a.m. and dismiss at 2:10. Reiki, Rowe, Lyseth, and Presumpscot will begin at 9 and dismiss at 3:30. Our middle schools and high schools will open a little bit later than they did in the past at 8:20, with the exception of Paths, which will continue with its previous 8 a.m. start time. Middle schools and high schools will dismiss at 2:50. Over the fall, as the board knows, we will be working on identifying ways to push back the secondary start times further as directed by the board's resolution back in the spring. So expect to hear more about those plans as they progress ahead of an expected board action in late fall. 3 of our schools, Longfellow, Presumpscot, and Reiki, are beginning major renovations that were envisioned as part of the Buildings for Our Future bond program approved by Portland voters in 2017. Lyseth School is wrapping up those renovations, and we have a busy fall ahead with formal groundbreakings at the 3 schools entering construction and a formal dedication at Lyseth. We were planning those activities for early September, but given the status of the pandemic, we will be holding off a little bit and hoping to be able to do these later in the fall. I would like to thank the families, student, and staff at all 3 of the new buildings that are going into renovations for their flexibility as we enter these repairs. As Lyseth families will tell you, the challenge pays off with amazing improvements in the building when they're completed. I'm pleased to announce that we've been given a grant by the Barr Foundation. This 3-year, $500,000 investment from Barr will allow us to continue our work on helping more students graduate prepared and empowered by focusing on the factors that prevent some students from reaching that goal with strong transitions, high expectations, and targeted supports for those off track along the way. The work we started with Barr in 2019 has taught us a great deal about the characteristics of what makes for a high school experience leading to post-secondary success. The next level of work funded through this grant will help us to ensure that that high school experience becomes the norm for all of our students. I would like to thank the Barr Foundation for their confidence in our commitment and capacity to move this work forward. And I would also like to congratulate and thank our internal team led by Barrett Wilkinson and Molly Myers with a strong supporting cast from district and school level staff. Tonight, I'm thrilled to welcome and introduce you to an amazing group of leaders who will help us to continue the important work we're doing as an organization. These leaders will occupy key positions, many of which were specific line items in this year's budget. The people goal in our Portland Promise, our strategic plan, commits us to working to attract the best and the brightest, and I believe we've accomplished that in the selection of these staff. Their knowledge, skills, and experiences will further enhance the quality of education we're proud to offer our students in the Portland Public Schools. I'm thrilled at the quality of people that we've identified for these key roles. And in addition to their knowledge and skills, many are homegrown talent, and they all have deep roots in the Portland Public Schools community. So I'm going to be introducing them in alphabetical order. I believe this is true, Greg, that we're going to spotlight them when I'm speaking.
Yes.
Perfect. So folks who are watching at home will get to meet them in person. So I'm going to start with Jane Armstrong, who's our Assistant Director of Language Development for EL Programming. Jane has extensive experience as an English language educator. Since 2020, she has been the district's EL specialist, working closely with Carlos Gomez to support our English learner curriculum assessment and instruction and supporting teachers. Jane has worked as a middle school teacher for over a decade before moving to her previous role. We created this role to provide a more extensive Donna or somebody who's watching on television with the delay. We've created this role to, we've created this role to provide a more extensive support structure to move our LAO plan implementation forward as we've stepped up our investments in supporting students or English language learners. Thank you, Jane, for your willingness to assume this important new leadership role, and we're excited to have you leading in Portland Public Schools. Next, Robin Bailey, the interim principal of Lincoln Middle School. Robin has been part of PPS since 1998. Most recently, she's been the assistant principal at Lincoln since 2018, where her accomplishments include leading interventions to reduce student chronic absences. She is stepping into the role of interim principal to replace Sue Ellen Santiago, who's leaving to become chief academic officer in Brunswick Schools. Robin has also worked as an ELL teacher at Lincoln prior to becoming the assistant principal. I would also like to mention that Kathy Marquis-Girard, who's the retired Portland High School assistant principal, will be assuming the interim assistant principal role for this year. So welcome, Robin, and thank you for assuming this leadership role. Next, Kathleen Kate Brogan, who will be our ombudsperson for the Portland Public Schools. Kate will serve as our first ever ombudsman. In that role, Kate will help to ensure that students know that we're committed to having safe school environments free of harassment and discrimination. She will help to intervene when we fall short of that goal, and she will do significant work to prevent these situations through training and the development of protocols and procedures. Kate has devoted her career to helping make Maine a healthier, safer, and more equitable place for members of marginalized communities as a consultant, advocate, and as an attorney. Kate lives in Portland with her two sons who attend the Portland Public Schools. So welcome to PPS, Kate. Maureen Fox is our special education and multilingual coordinator. Maureen has extensive experience in special education and teaching English language learners for over more than 30 years here in the Portland Public Schools. Most recently, she served as a consultant to the Maine Department of Education while she was on leave with us, and is now returning to help us operationalize our plan to effectively support students who are identified as both English language learners and with special education needs. Her focus will be on ensuring that those students are held to high expectations and have the appropriate cultural and linguistic supports to fully access the curriculum. Welcome back, Maureen, and we're glad you're leading this work. Next, Courtney Graffius is our Technology Integration Coordinator. Courtney is an experienced technology integrator and instructional coach, and she's joining us from the Scarborough Public Schools. There, she served in a similar role for the past 9 years as the district's new technology integration coordinator. As the district's new technology integration coordinator, she will help us build on the past year's innovations and new learning and align instructional technology with the district's academic priorities to lead to more equitable outcomes for all students. Courtney has been involved with the Portland Public Schools as a PTO parent, advocate, and volunteer for the past 6 years, including as a parent representative for outdoor learning. So welcome to PPS in your new capacity, Courtney. Julia Hazel is our Director of BIPOC Career Pathways and Leadership Development. For the past 6 years, Julia has been informally organizing and supporting Black, Indigenous, and people of color educators in the Portland Public Schools and statewide, while also working full-time as a classroom teacher in the district. In her new role, she will formalize that and serve as a resource and support the current BIPOC educators, create career advancement pathways and leadership opportunities for educational technicians and teachers, amplify BIPOC excellence and expertise, and foster relationship building and mutual support within the BIPOC community. Julia has a total of 16 years of classroom teaching experience, the last 9 in the Portland Public Schools, where she has taught at Talbot, Reike, and Rowe. And she co-created with Fiona Hopper the district course on race in the United States, Perspectives for Portland Educators, which the board went through last fall. She co-authored with Alberto Morales and Dora Santoro the Educators of Color report, which was released this past spring and served as a clarion call for the creation of, among other things, her new role in PPS. Julia, thank you for your many contributions to date, and I'm so excited about how you will build on those contributions in this new position. Thank you for taking this challenge. Priya Natarajan is our high school math instructional coach. Priya is another homegrown talented leader stepping into a new leadership role. She's an award-winning math teacher and teacher leader with almost 2 decades of PPS experience at Adhering High School and more recently at Casco Bay, and also serves as an adjunct math lecturer at the University of Southern Maine. Priya's extensive relationships and the trust she has built over time in PPS high school buildings will aid in her new role as math instructional coach. I can think of nobody else who would be able to lead our high school math curriculum and instruction work better than Priya can. Priya, I know how much you love teaching your students, and I am incredibly grateful for your willingness to take on this challenge to support math instruction across the district. And last but not least, Catherine Katie West, who's our outdoor learning coordinator. Katie is an experienced and passionate proponent of outdoor education. She joined the district only last year, but she's been teaching in the field and in the classroom for the last 24 years. She's passionate about using outdoor learning to connect students to the context of their immediate environment, the world at large, and ultimately back to themselves. In her new role, she's eager to help the Portland Public Schools build on the nationally recognized outdoor learning program the district has developed over the past year during the pandemic and integrating outdoor learning into the Portland Public Schools vision of equitable access to these experiences for all of our students. Katie, we very much look forward to working with you to advance this important work. So I want to welcome all of these amazing leaders, thank them for joining the Portland Public Schools in these new roles, and that concludes my report.
Thank you so much, Mr. Superintendent, and welcome to all of the staff. Thank you for all of the work that lays ahead of you. Now we are going to move to the report of the Secretary. Mr. Rodriguez.
Thank you, Chair. Just really quickly, since the personnel announcements that the superintendent just made are not it's not something that the board is going to take action tonight. I would like an opportunity for the board to have a short discussion with the superintendent about his appointments. So I'd like to put a motion for us to enter into executive session to discuss a personnel matter.
Are you requesting that at the conclusion of our meeting tonight?
No, at the moment, I'm putting a motion on the floor for us to enter into an executive session to discuss a personnel matter.
Is there a second?
Second.
All right. Sarah, do you want to help me on procedure a little bit?
I've never had one of these, so.
This has come up before, particularly remember when we went into executive session impromptu to get legal counsel on our SRO MOU. That was not on the agenda, but we did it on the spot too because it was a matter of timely communication.
I think if, I can weigh in, I think it can be done. I am concerned with everything that's on the agenda today, that we are doing this. Again, this is not an action. None of these are appointments that require action on the part of the board. So I would be very comfortable going into an executive session at the end of the meeting, or, call a special meeting, for an executive session on the topic. But I just am super concerned that with everything that we have on the agenda today, with people, waiting for, for the discussion on school reopening, we have a group of students who are waiting to speak on the work that they've done in Reimagine education. I'm just super concerned about going into an executive session on the spot. I don't, again, I don't think that there's anything that is going to result from it other than having a conversation, and we can do that at any other time.
Yeah, I agree. I don't expect the resolution I don't expect there to be any need to resolve anything tonight, and which is why I think the executive session will not prolong or not take too long, as a matter of just having a quick opportunity to be transparent about some of the information that you shared with the board a few moments ago as you made your announcements.
Okay, so we have a motion and we have a second. I see from our legal counsel that a shake of a head that would be appropriate to go into executive session now. Absolutely, absolutely. So I just wanted to see if there are any questions on the motion from the board. Okay, seeing none, is there any discussion? Any other discussion? Ms. Trevorrow?
I just want to express my concern with going into executive session now. Unfortunately, I do have to leave the meeting at 9:30, and I was hoping to be here for the crucial vote. So I would prefer to do it later. I would be supportive of a motion to go into it at another time. So I may vote against this motion.
Okay, thank you, Ms. Trevorrow. Anyone else? All right, with that, we are going to vote by roll call on Mr. Rodriguez's motion, which is to break from our meeting right now and go into executive session. Mr. Superintendent, will you please call the roll?
Yes, Madam Chair, Ms. Bondo?
Yes.
Mr. Burke?
Yes.
Mr. Irish?
Yes.
Vegas?
Yes.
Ms. Russell Better?
Yes.
Ms. Thompson?
Yes.
Ms. Trevorrow?
Yes.
Mr. Youssef?
Yes.
So the students cannot go into executive session, so can they vote to? No.
We're specifying that it's section 4. Would you mind coming to the microphone and stating that? Thank you so much, Melissa.
It would be under 1 MRS section 405-6A to discuss a personnel matter.
And will you just identify yourself for the public?
Oh, yes. My name is Melissa Huey. I'm a counsel for the school district.
Thank you so much, Melissa. Okay.
So Chair Figdor.
Yes. So the motion passes unanimously, and we are going to break for an executive session. As indicated before, we're going to try and aim to keep this short so we can come back and move on through the rest of our agenda. Okay. Good evening, everyone. We are back from our executive session. I want to review some changes that we're going to make to tonight's schedule to be able to focus more of our time on the reopening plan. So we are going to skip the committee updates that we had planned to do tonight, again, due to the late hour already, and to get us more quickly to consideration and action on the reopening plan. We are also going to postpone the workshop on the Charter Commission that we are going to do tonight. And we will do that at one of our September meetings. So those are two changes we're making to the agenda, and we're going to go right now to the report of the secretary. So this is consideration and action to approve the meeting minutes of August 3rd, 2021. Is there a motion? Ms. Thompson, seconded by Mr. Youssef. Are there any questions on the motion?
Here.
Yes, Mr. Burke.
I have a question related to the documentation of people's addresses in our notes, and if that's a new procedure and why it wasn't uniform in the notes.
I record addresses when people say them out loud in the meeting. If they do not list their address, I do not add it in.
Okay, are there any other questions on the motion? Thank you, Anne. Okay, seeing no questions, is there any public comment on the motion? So this is specifically on the minutes from our last meeting, from our August 3rd meeting. If you're a member of the public and want to comment on our minutes, you can use the raise your hand feature in Zoom. I do not see any public comments, so we're going to move to board discussion. Is there any board discussion? Mr. Rodriguez?
Just to follow up on Mr. Berg's comment, I think the chair has been doing a good job tonight at asking for the addresses. So I think we'll see that reflected in the minutes, but thank you for Mr. Berg pointing that out.
Thank you, Mr. Rodriguez. Okay, seeing no other discussion, let's move to a vote. By roll call vote, please indicate whether you are in support of approving the minutes from our August 3rd meeting. Mr. Superintendent, will you please call the roll?
Yes, Madam Chair. Ms. Bondo?
Yes.
Mr. Burke?
Yes.
Mr. Irish?
Abstain.
Mr. Rodriguez?
Yes.
Ms. Russell Better?
Yes.
Ms. Thompson?
I was not present. Abstain, please.
Ms. Trevorrow?
Abstain.
Mr. Youssef?
Yes.
Ms. Allen?
Yes.
Ms. Chung?
Yes.
And Chair Figdor.
Yes. So the minutes pass with 6 votes and 3 abstentions, and the students voting with the majority. And now, again, we are going to postpone the committee reports and move right into our board focus on educational issues. Mr. Superintendent, will you please introduce this agenda item?
Yes, sorry about that. Tonight, I am particularly excited for the board to see the results of the work of our students and their adult allies who spent time this summer, quote unquote, reimagining education. They will speak to you about their work, which will affirm the need to continue to work relentlessly to become anti-racists if we're going to create safer and more welcoming and more just schools. These students that you will see today are not indoctrinated students. Instead, you will see them as the living embodiment of what we strive for through our Portland Public Schools education. Students who are prepared and empowered young citizens who are committed to evidence seeking and truth telling. And with that, I'm going to turn it over to, I'm assuming Muntaha or Barrett, that you're going to introduce the students and talk a little bit about the process.
Yes. Hi, everyone. My name is Muntaha Mohammed. I use she, her, hers. I work with Portland Empowered, and one of the projects that we have been working on is called Reimagine Education. So I have a couple of students, as well as Barrett here as a very wonderful supportive presence. So Barrett, and with students, 2 were able to show up because of the late time of our presentation. Most students who participated weren't able to join today, which is, I mean, unfortunate, and also all of the information is the same. And for the 2 students that we do have, I know Emma has to maybe go in 15, and Nicole might still be having mic issues. But if not, Emma, I think you are still here. Would you like to introduce yourself and your role, I guess, in Reimagine?
Hello, my name is Emma, and I was part of the group of youth who shared and collaborated ideas. Mainly, that's what I did. I just kind of gave out ideas, and we kind of built off of each other's ideas to reimagine education.
Great, thank you. And Nicole, is your mic still not working?
I think I fixed it. Can you guys hear me?
Yes.
Okay. Hi, my name is Nicole. I use she, her, hers, and I was an intern, a part of Reimagine Education.
Awesome. Thank you. And Barrett was one of the adults that helped with the collaboration efforts. So I actually have a slide presentation. Can I have? I think I can. Yes. Oh, I can. Great. Okay. Oh. What? Oh. That is what I meant. Okay, so Reimagine, for those that are not familiar with what it is a collaboration between Portland Public Schools students, faculty, administrators, and community members. This began last summer in 2020 in response to inequities in our education system and the uprisings that were happening, and centering the experiences and expertise of youth with regards to racism. Reimagine is designed so that young people and adults have the space to meaningfully partner, analyze, and problem solve the issues impacting young people. So this year we focused on several different things. And so a few of those topics are different strategies of change making, which we'll do a little run through of what that means so that everyone can be on the same page. Transparency and accountability, defining power, specifically what it means to cede power, and redefining youth voice, BSUs and racial affinity groups, implicit bias and anti-racist training, restorative justice. And yes, thank you to the school board for offering us the opportunity to share. And so some of the strategies in change making, we were inspired, the work of Reimagine Education was inspired by something called the 4 R's, which is just a framework for understanding different social justice approaches. So things like reform, resist, recreate, and reimagine. And our project focused more on ideas that were towards recreating and reimagining. So I think most of us have an understanding of reform, so I won't spend much time here. But it tackles immediate needs and requires our current social and political institutions to provide remedies to pervasive social problems. So this approach includes human services and policy development. And then resist, which approaches include direct action, community organizing, and campaign work. And then I'll actually go to recreate first. But as we resist and succeed at dismantling current unjust systems, we will need to erect new alternative institutions and paradigms. So recreate, generating new systems. And so this strategy enables us to experiment with new ways of constituting our society, by building entirely new models, forms of governance, and leadership structures. Approaches can include democratic school, restorative justice processes, and local economies. Oops. And then Reimagine, which is where a lot of the vision was with this project, was trying to engage how we think about ourselves in relationship to each other and as a whole community, and was really tapping into our individual and collective ability to dream up and to engender new cultural norms. So approaches can include the arts, media, academia, cultural, and spiritual traditions. Oh, yes, okay. All right, so just to offer some ideas on what some of our cohort was thinking about when it came to all of these social justice approaches. These are reflections that came out of conversation, and these are quotes just pulled from our notes. So one person said, I think about how much tension there can be between the 4 R's. One person may think that it's a reform, where someone else can think that it's been totally reimagined. And then moving forward, I think that as a society, we need to move towards recreating and reimagining. And then another one said, something I learned with boundary work, saying no is resistance and a path towards reimagination. Because this one is actually, someone else made this slide, but this is actually my quote. And what that meant is that every time we say no, it opens up a path towards our yes. So every time that someone resists, it opens up a path to reimagining something new. So this is the list of different priorities with just like focuses on each part. I wanted to ask if Emma or Nicole wanted to read through just what is on the page here.
I can read the first one.
Yeah, thank you.
Black student unions and racial affinity groups prioritize BSUs, give them space to lead and provide uplifting support. Administrators consult with BSUs in addition to student councils, and support affinity group structures through recognition, funding, events, and workshops.
And then the anti-racism and implicit bias section focused a lot on ideas surrounding implicit bias training for teachers before interaction with students, incorporating student voice and power in school hiring processes, diversifying curriculum and teaching with an anti-racist lens to analyze problematic aspects of what is already present in the curriculum or past curriculums. Yeah, I think that mainly is in response to when it is difficult to just change the curriculum overall. Like if you're going to use problematic things, then at least like take the time to analyze the problematic aspects and not normalize them. Have a place to talk about racist and discriminatory incidents in school, and say names correctly. And Emma, before you leave, do you want to read off the last one?
Sure. In the restorative justice group, they discussed things about acknowledging past and present harm and racist mistakes, and especially being about transparent about the work to repair. I guess that's about communication between like the adult and like the youth. And then invest in restorative practices versus punitive disciplinary practices, and faculty students are educated about restorative justice. There's a lot of things about transparency and being clear.
Thank you, Emma. And also have a good rest of your night whenever you do leave. I know you're leaving soon. So thank you for joining for as long as you could. And so I will copy and paste the link to all of the recommendations and ideas that our cohort came up with. It's a much longer list. This was just meant to focus on the 3 themes and I guess overarching ideas that our group focused on and key points that came from each one. So a really big element that came out of all of the conversation and has been a very consistent theme is the value of transparency. Consistent transparency builds trust and accountability, and there's a really big need for it within the school district for both students and I'm sure also parents. So with student voice, be clear about what you mean when you say student voice. Does that mean students have decision-making power? Is their role to consult? Are you actively incorporating their ideas, critiques, and input? All of these are questions to avoid tokenizing, because a lot of the time when people try to incorporate student voice, it turns into a tokenized role. So this ensures students can make informed decisions about the spaces they join and if it meets their expectations to participate. And then another big concept when it comes to transparency is repairing relationships after harm. So this is a restorative concept. If you've been harmed, but you aren't part of the healing, that's a problem. So and this kind of goes under disciplinary action ideas and recommendations, but involve students in the process, partner with students to ensure their needs are being met, be transparent about what steps are being taken, and provide consistent updates that are accessible to students. And be accountable for what you commit to. So when it came to collaborating this summer, again, we did this last summer where it wasn't all of the same individuals that were involved in the group. And still it was kind of building off of what work happened last year. There was a big list of recommendations, and last year the focus ended up being more on kind of bringing adult allies up to speed on what youth and students need, then actually being able to get into the work of collaborating. And so that was what the vision intention was for the summer. How do we actually collaborate and turn all of these recommendations, beautiful recommendations that youth worked very hard on to identify and write down and thought a lot about, how do we turn that into reality, knowing that often youth don't have decision-making power to be able to put a lot of these things into action. And so knowing that that is needed, knowing that adult support and adults with decision-making power are actually really needed in the process of moving things forward. It can't just be saying, hey, youth, you go on and come up with this idea and fix it. It has to be a co-created process. So that's what we were trying to do. And because it was the summer, it was easier to bring people together. And also there were still a lot of different challenges to collaboration that came up both in this summer, but also just envisioning how do we continue collaborating, and these different ideas around conflicting schedules, difficulty implementing the idea of risk-taking and adult buy-in are things that will continue to be challenges, especially throughout the school year. So under conflicting schedules, it's hard collaborating with students and adults outside of the structured responsibilities of school time, work, and family, etc. All of those responsibilities that are already structured into the day. It's hard to add another thing on top of all of that. And then conflicts in scheduling impact adults who can participate and also students that would want to participate, except they don't have the time for it. And then there's the challenge around difficulty implementing. I think we experience, like, because there's not a clear path forward to turn recommendations into reality, because it's a co-created process, as I said, it requires ingenuity, support of resources, and ongoing commitment from more community members. It was hard to just figure out all the ways to plug the recommendations into reality. And then also, students don't have the same understanding that teachers and staff may have on how the school system works internally. So ideas like chain of command or who to go to in order to ask questions about this specific thing. I think that's also where the ask for transparency comes in. It's just like, we don't, this idea of not knowing how the school system works, so then not knowing ways to plug in what the changes that are needed. And then risk-taking, this idea of what can we do, often can be while, like, yes, we do need to be rational, but there's a difference between being rational about putting things into practice, like what are we able to do, and there's a difference between that and just compromising needs and letting them go because the system as it is doesn't allow those changes that are being asked. So that risk-taking part of what can we do versus what do we want / need to do. So this is more about finding the balance between radical and rational change making. And then one of the other challenges is just needing more investment from staff, teachers, adults, needing more investment in time, resources, and effort. This is not to say anything about the adults that helped us in this cohort this summer. This is more about thinking about how much more collaboration is needed and how there needs to be more investment from people in the school district to be able to be a part of the collaboration to actually move things forward. And needing adults to bring in their colleagues to join forces and educate each other, and also to step up for student voice in the rooms where youth are not there. So just keeping that in mind. I don't exactly know how to say that better than I did right now, but the last thing is adult buy-in to seed structural decision-making power to students. So this is like how to get more adults to get on this this train of, okay, let's seed structural decision-making power. Let's try and yes, yeah, I just said that. So Nicole, this is you.
So call to action, building a culture of meaningful youth and partnerships. Share the work, what you're doing. Could you help me with this?
Yes, sorry. Yes, I can start and then just fill in, I guess. I can start and frame the different sections. We weren't able to prep as well as we could have because of the not understanding what time exactly we were presenting. So that's that's why I'm doing most of the talking. Anyways, just wanted to be transparent about that. Thank you, Nicole. So I'll frame up each section. So this is a call to action asking, like, yes, this was time for us to present what we worked on this summer. And also the work is not over. This Reimagine 2021, I mean, we're closing, we have our closing meeting tomorrow. It's not the end to the work this summer. It's just meant to be like a jumping off point and also a celebration of the work that is already happening. And so as we are ending for this summer, we're wanting to continue the work, wanting to continue the collaboration. And that's where a lot of you come in, because, and one of the asks is to share the work that you're doing.
Oh, yeah. We kind of like, we want to take it more seriously, but we need your help to like know what we need to do. And we want to be like included in every decision, or at least know what's going on. There needs to be like transparency and consistency, like updates like every week, even if it's just a small update on the work that they do afterwards. You guys do afterwards. And collaboration is a really big part of Reimagine education. So I hope collaborating with you guys would be smooth and good. Yeah.
And to add on, I especially just want to point out the last point in continued collaboration, which says support and building out action plans. Use your knowledge of the system to find avenues for change. This, along with share the work you're doing and consistent and transparent communication, have been the biggest things that we've just heard over and over again from youth and students that they need when it comes to meaningful youth-adult partnerships. Thank you, Nicole. So that was actually our whole presentation. And so now is a time for question and answer. And Nicole and I will both be able to answer.
Thank you so much for that presentation. Are there questions from the board? Mr. Rodriguez.
Thank you, Chair. I guess just the first initial question before I thank for the presentation is just if we can have a copy of the slideshow, just so that we can access it. So that, I guess I'll start. I'm looking this way just because that's where the screen is, but I guess the camera's here. Maybe I should be more aware of that. I want to thank you, the Portland Powered, for your work and presenting tonight. This is really amazing. I see a lot of parallels between the presentation and a lot of the highlights that you over a lot of the points that you highlighted with what the board has expressed as an interest as well. So that's a really solid and positive place to start. I really just wanted to make a comment. Often when I hear from our students and from young people, I hear very, very similar points. So it makes me think that a lot of the work that we need to invest in is really to teach the adults how to listen to young people. Because we hear the same thing over and over from our students. And I don't think that we've invested very much. And I think teachers are really good at this, right? Like teachers are good at listening to students, but also on the board. Because when I hear about leveraging the knowledge that we have, the institutional knowledge, I hear like that's a message directed to us. But us on the board, us elected officials, community leaders, we can probably invest or benefit from investing some time into just learning how to listen to young minds, because they communicate differently than us older folks. So we have to open our ears a little bit differently. Other than that, I'm going to support anything that the district can do to implement some of the recommendations from the Portland Power Group. And again, just want to underscore that there's a lot of alignment already with what this board has expressed. It's important for us to provide for our students. So I'll leave it at that. Thank you.
Thank you so much, Mr. Rodriguez. Are there any other questions from the Ms. Bando?
Thank you, Muta. Thank you for a great presentation and for all the student participation. I just need to know if there's going to be some follow-up from those conversations or just a presentation and is over. Are you going to plan to have more meetings and follow up just to keep the momentum going on? Because we just need to make sure, like Mr. Rodriguez just mentioned, to be partner with the youth generation. It's not just like you just said, is that what you need is exactly to be a partner. So we're building the change, all of us together, because your voice is the one we are here. So this is so important. So I just wonder if it's going to be some continued conversation and some workshop participation, and some board member can, attend and listen and be in the front place with a student at the same time. Thank you.
Thank you, Mickey, for that question. Nicole, did you want to answer or do you want me to start and then you add?
I can start it off.
Great.
I believe that Reimagine Education, the whole internship thing, it's like a reoccurring thing during the summers. So it might slow down, but if we keep adding recommendations and if we build more and more so that it won't stop, then it'll be better. It will, yeah.
Yes. And also, Reimagine is kind of the same thing as Youth Engagement Partners, which is Portland Empowered's program that happens throughout the school year. So Reimagine Education will continue. It's just the same work under different names currently, but we'll probably change to have a more cohesive, so that people can have a more cohesive understanding. Yeah. So, meetings will continue, and they'll be led by 2 other staff members in Portland Empowered. I actually will be not working for Portland Empowered past August. So there absolutely is follow-up moving forward into the school year. And so that's where the call to action comes in, to bring awareness towards the work that Youth Engagement Partners have been consistently doing throughout each month, basically. They go school year and summer. And Nicole joined as an intern this summer for the first time. So there's always continuous recruitment and continuous involvement. And it's, yes, so there is a lot of space and opportunities for you all to join in and offer ideas for how you'd like to collaborate as well too. And I also just wanted to respond to the first comment, and I forget, I can't exactly see your name right now. I apologize. But to the first comment that it's learning how to listen can happen at the same time as learning how to do, which is the biggest ask right now. Of course, yes, always listen to student voice and youth voice. And also there's a really big call to actively collaborate and put things into action and partner, as Mickey said. So, yeah, thank you.
Thank you. Are there any other questions from the board? Mr. Burke.
Yeah, thank you. My name is Adam Burke, and my question is related to the communication ask that you had, as well as the identifying opportunities for action. To get more concrete with a preference for how we might communicate with you with what's happening from the board and opportunities for you to be involved, and how, what does that look like more concretely? Does it look like a quick video from representative on the board after a board meeting? Does it look like a Google Hangout once a month? Like what does that look like? Because we only use like bureaucratic means like meeting minutes right now to communicate that. So what would be more effective?
Yeah, thank you so much, Adam, those ideas. I think one, there were some ideas just in the all recommendation document that is already listed. I know that some of the communication is asking for each school to do report outs as well. So I know that within the schools, there's an ask for like weekly, both like weekly announcements and like verbal announcements, as well as like written announcements too. And I'd say that those are ideas that sound great, like specifically from the school board. And I think it would just be up to youth to decide which ones from what you offered. So yes, I think that is great. And if you could email me, I can make sure to save those ideas so that we don't lose it. And we'll be able to follow up with you.
Mr. Burke, will you follow up via email?
Yes, and I'll CC you, Chair.
Thank you. Are there other questions from the board? I just want to echo Mutaha. Thank you so much. Thank you to Portland Empowered. This is really valuable. And I think that there's a lot of interest among us board members to support and see through the recommendations. And so really look for me, getting away from tokenization and real deep collaboration and recreating education is where my interest is. So thank you so much for this work, and I look forward to supporting it in any way I can as a board member.
I would like to comment as well. I think one of the things that was striking as I looked at the recommendations, when you guys were still working on them, was, how many of the things that that are coming out of that work are things that we think that we're addressing as an institution, as an administration. And so, I know that a big part of what the recommendations speak to is transparency and communication. And, really sort of brings home for me that, two things. One, that we're obviously not communicating particularly well about them. And I think the other one is related to Mr. Rodriguez's point that, maybe what we think we're doing is not really the same thing that you're thinking. And so, the deep listening and, trying to really understand why it is that the things that we think we're doing don't resonate the way that we think that they should. And so, I know that our team was involved this summer in the Reimagine work, and, we're committed to continuing to be in that. That's why I thought it was so important for you guys to be here today, recognizing that your last meeting of the group is tomorrow. And so you guys have not really formalized your final recommendations, but I, just knowing the timing of multiple things, I thought it would be really powerful to have you guys here. So I do think that the takeaway for me is, how do we really truly understand what it is that our students are telling us in ways that isn't just our interpretation of it. And I think, one of the board knows one of our priorities for this year is to really elevate the voices of, students and families who traditionally aren't at the table. And so this is a great example of one of the places where we're trying to do that and, trying to bring that to bear on our work. And then I know you mentioned it in passing, but I want to make sure that everybody on the board knows this, that Muntaha is not continuing to work with Portland Empowered, not because of anything else other than the fact that she is going to graduate school at Howard University starting in September. And so we're super sad to lose you, Muntaha. You've been an amazing force in working with our student leaders in YEP, and we know that you're going to do amazing things, and we're just thrilled to have you here one last time and grateful for everything that you've done, and looking forward to getting you back after graduate school to continue that work.
And before we move on to the next agenda item, I believe Pius Ali may want to talk with us as well. Pius, you are moved over as a panelist, and you can unmute yourself and go ahead and speak. Thank you so much.
Thank you, Madam Chair. My name is Pius Ali. I work at Portland Empowered. I just want to add that, Muntaha, thank you very much. We are going to miss you, but as Superintendent said, we hope that you will come back and continue the work that you started doing. The work that the students did will continue throughout the year. We have two people that will take over from where Muntaha left. It will be the year-long work that the students will look into the recommendations and work with the district to make sure that it is a collaborative effort between the district and the students, and they will work on it throughout the school year. Normally in the summer, students do these, and then they will identify issues that they will work on for the rest of the school year, and that will be the continuation that Muntaha and Nicole were talking about. So we are looking forward to working with you. Thank you very much for the opportunity for Muntaha and the students to share the work that he did this summer with you. And thank you for your continuous collaboration with Portland Empowered.
Thank you. And I wanted to say thank you to Nicole for rolling with this presentation. She came from tryouts, and that went from 5 to 8, and with really little to no prep, just jumped in to help to present today. So thank you so much, Nicole.
Thank you to Nicole and Emma for being here. We know that the schedule was a little crazy today, so thank you.
Okay, thank you so much. We're going to move on to our next agenda item. We're on to consent items. And Mr. Superintendent, will you speak to this issue?
Yes, under Board Policy KCD, the school board accepts by unanimous consent contributions made to the school district. As required by that policy, all of the donations are listed in the board agenda under this item. Our practice is for each donor to receive a written contribution acknowledgement expressing our heartfelt gratitude, as well as for their tax purposes. And I would like to thank the contributor, a frequent contributor to the Portland Public Schools, who has made another donation of durable goods, goods of substantial value and historical or commemorative significance. In this case, another $200 for the PHS food pantry from April and Dennis Noonan. And we're very grateful to the Noonans for their generous support and contribution to the work of the Portland Public Schools.
Thank you so much. Now we're on to old business. Consideration and action to approve the administration school year 2021-2022 school year reopening plans for a full return to in-person instruction while adhering to public health requirements. Is there a motion?
So moved.
Mr. Rodriguez, seconded by Mr. Irish. All right, we are moving right into questions since the superintendent has already presented to us. And bear with me, board, as I try to see across the room and get a queue going. So what questions do you have? Ms. Trevorrow.
My only question was the portion of the presentation where we're looking into vaccine requirements. How will that, I know you said it would be ready for September. Will it be something we have to vote on in addition to this, or how will that work procedurally?
So my goal is to bring a recommendation to you at the next board meeting that will be informed by the data. So if there were a recommendation to move forward with a vaccine requirement, then I would bring that to the board for a vote. If that's not my recommendation, then obviously there's nothing to vote on.
Okay, thank you.
Yeah.
Ms. Thompson?
Thank you, Madam Chair. So thank you for the suggestion of listening to the last meeting that I missed. It was quite extensive, you're right. But I had a few questions based upon listening to the meeting that took place as well as this evening, and I just was wondering, just for clarification purposes. So I'm wondering if there was no way we can do all testing instead of volunteer pool testing, and has the state limited us on how many we can pool or test using federal money? Did we just choose K through 6 because they can't be vaccinated? And why wouldn't we do middle school and high school? Could you elaborate on that a little bit?
Yeah, we are doing K through 6 because those are the grades that can't be vaccinated. So this was an additional mitigation strategy. So if you think of universal masking and then vaccination and promoting vaccination is, another mitigation strategy, particularly for middle school and high school for the students who are eligible. And then the pool testing is a alternative to vaccination, since that isn't available to us at this time. As I mentioned in my presentation today, we're open to considering expanding that as time goes by. We really want to first, see how it works. We want to see how well we do at getting people to sign on to pool testing. It is, families have to consent to the testing. So it is not something that we can require of our students. If they don't sign the consent, the only alternative we would have is to exclude them from school, which seems to be, counterproductive, when what we're trying to do is get more students into school. So, the experience for school districts that have done this is that it starts with fewer people. And then as people start to see the value of the pool testing, that we would see an increase in the number of folks participating. So we want to try to see how that goes for us, and then if we think that it's adding value, then we will expand it to other grades. So
I was just wondering that because I know last year we were talking about with the high school when they weren't returning is because they changed classes and then keeping those cohorts together. So that's why I was kind of curious about that. And then I'm wondering, I saw that you had about the athletics, and I'm wondering if we can't, again, require it for that, because with the sports, there's going to be so many interactions with different districts and different students. So I have some concerns there about the students, again, middle school and high school, especially because it doesn't happen through K through 6, is that they're going to be having so much interaction on the fields with other school districts. So I'm just wondering how do we mitigate that, or how do we?
Well, I think that's why that's one of the places where we will consider expanding it.
Okay. And I apologize. At what point would we pull the trigger on that one? Like, how would we?
I think first we really want to get ourselves to a point of seeing how we do.
Okay.
This is a very significant undertaking for our nurses. We're relying on staff that hasn't been hired yet by the vendor and by the state to help us to manage that on site. And so we want to see how we do with the place where we think it's absolutely imperative as an additional mitigation, and then add it into some of these other places that we think it will add value, but we want to first try to do it. So I don't know, I think that it's a significant investment of time and energy, and we want to make sure that we can do that before we actually expand it.
Okay. And you talked about busing, and I know, with our shuttles, et cetera, at work, we have a limitation of how many of us can be on the shuttle at once. And you talked about 2 to a seat. I'm wondering what conversations we've had with the Metro and what precautions they have in place, because we have the high schoolers riding the Metro. Do we know what their protocols are
I mean, they follow the masking protocols that are in place, for public transportation nationally. They, I believe, and I don't know, Erin, if you know this, are they currently limiting their, I don't know what they've done recently. I know that at the end of the year that they had, that they were no longer placing limits on the number of people that could ride a bus at a time. So we can find out what they're, what I don't know if with the Delta variant, if they've added any other, limitations on their use.
And I'm wondering about contact tracing for the high schoolers that will be attending potentially SMCC, USM, or other, college level, and what kind of contact tracing we're doing for that.
I don't know. Tina, do you know?
Well, the school nurse would be involved in any contact tracing of a case we find out about at school, but positive cases will still be reported to the CDC, and they would have a state contact tracer also if they were, like if it was extensive at another building they were at outside of Portland schools.
So like if they take a class at USM and there's, particular positive, they will trace that back and make contact with.
So if it was our student, we would probably contact someone if they're in a class at USM, contact someone at USM. We wouldn't be doing all the tracing for the other students at USM that aren't.
No, I mean vice versa. So if there's somebody that on the college level that is, turns out positive, are they contact tracing back to us?
Every positive case is still reported to the CDC. So that USM student would have an investigator and would look at that through USM.
Okay. All right. And then my other question is, you talked about the vaccine clinics, and I'm wondering if we were going to do potentially a vaccine clinic at adult ed. And I know that one time when we were opening the Amanda Rowe Clinic at Portland High School, we had some parents coming in. It was open a little bit more for the public. And I'm wondering if we are going to potentially offer as well the parents of some of our students the opportunity to come to our clinics to be vaccinated as well, if you are doing that for the...
Well, right now we have one clinic planned September 11th at the back to school event at East End, but that's or targeted at our multilingual families, and we're going to have a pop-up clinic there where parents, can, be vaccinated. We haven't talked about that. We are working with the school-based health clinics to be able to offer vaccines ongoing, probably not weekly, but maybe a couple times a month, particular days. We haven't talked about opening it to parents.
And then in the spring we did, they were using King, Greater Portland Health. Weren't they using King for?
They were. Yes, they were. They're not doing that now, but parents can get vaccines at Greater Portland Health.
Okay. I just didn't know if they could potentially get it, through us as well. We had it as an ongoing opportunity because if they're there with their students or, what have you, but. Excuse me. And have we thought, I work at Maine Medical Center and I had lunch with Javier the other day and I was showing him our badges. We have, for those of us that are vaccinated, which for all healthcare workers, it has to be as of October 1st or we lose our jobs. And we have stickers on our badges. And I'm wondering if we've thought about, and I know that some people have feelings one way or the other of calling out, but it is an indicator, and I'm wondering if we've thought anything about that when we, with our staff, to know who is vaccinated, who isn't vaccinated, and if that's something that has been thought about for us.
No, we haven't talked about that.
And then for the superintendent, also something that we do at the hospital is the limitation of each conference room or a meeting area has a space limitation. And I know that you said about 100 under this and 100 over that. With the smaller rooms where they're not student contained? I know you've talked about that with the distancing. So based upon square footage, are we saying, you can have X amount in the lunchroom at one time? Because like, for instance, in our lunchroom on my floor, only 11 people are allowed because based upon the square footage of our lunchroom. So I'm wondering, are we doing anything like that?
I spoke to the fact that we are having a limited number of people in the lunchrooms at all times.
For staff and so any kind of trainings, et cetera, that we have professional development, there's a max capacity that they can go in where they're taking a class, et
And
cetera.
again, we're urging people when they are, when it's possible to do that outdoors. I talked about the fact that we did that today with our new teacher orientation and held that outside in a tent as, in an effort to make it, safer for people.
Okay. I thought I had one more question, but and I don't understand my own writing, but I had something around the medical accommodation for remote, but significantly smaller. What do you foresee number-wise for the medical accommodations?
Good evening, everybody. So to date, in the applications have been available.
Mr. Townsend, will you please just introduce yourself?
Yes, thank you. Aaron Townsend, Assistant Superintendent of School Management. So to date, we've had 21 requests. Of those 21 requests, 7 have submitted kind of the medical documentation that we've asked for, in which a healthcare provider is recommending or requiring them to participate because of either the student's individual health concern or somebody in their immediate household. So we've had 7 students submit documentation thus far. And again, we communicated last spring with students in Remote Academy about who we might anticipate requesting this, believing, that students who are back in person already at that time, right, were already comfortable being in person. And so we've communicated directly with all those families that indicated a potential interest. And thus far, and that was in early August, thus far, we've only had these 21 requests and only 7.
And that's the one we extended the deadline that you spoke of, Superintendent? Yeah. Okay. And I guess the only other thing I have, and I asked Ms. Vail about this, that with the state law that went into effect in 2019, and it was upheld in the referendum of 2020 about the law deleted philosophical and religious exemptions from vaccine requirements for measles, mumps, rubella, so on and so forth. And I just had asked her how we were going about looping back around with those families that potentially had philosophical or religious exemptions, because now it's a requirement. So I was just had been curious about that.
So those families have all been contacted numerous times since that's gone into effect, and some have started vaccines and some have withdrawn from school.
Thank you.
Yeah.
Well said.
Thank you, Ms. Thompson. Ms. Russell-Better. And then after Ms. Russell-Better, I have Ms. Bondo and Mr. Burke.
Thank you, Chair. I have several questions, so I thought maybe I can just start with ones for the superintendent, and then if Ms. Vayu doesn't mind coming back with ones maybe more directed to her. So I just had a question, Superintendent, about so an article that I think the board was all made aware of to read from the New York Times that that has quotes from Dr. Maldonado, who's a professor of pediatric infectious disease at Stanford, has had information from this specialist about how most of the cases that they're seeing of people who are getting COVID, or I think it was referring, I'm not sure if it was referring to vaccination, but just what stuck with me in the quote in this article was that people have been sitting together, eating and drinking, with masks off is where, they're seeing numbers of, of COVID infection. So I think just in thinking about that, and then then also in this article that was talking about the 100 largest districts in the country that are doing remote options. 8 out of 10 school districts are doing those. And so, I'm sorry, I think that quote was more for another question, so I apologize for that. But the article also was talking about the remote option. So I'm just curious, in our situation here, which obviously we're not one of the biggest districts in the country, but looking at that where districts are moving, I mean, I guess I'm just curious what the thinking is for our plan that we're not including that, or we don't have a plan right now for the remote option. Just wondering if that may shift or change. So,
What we do.
well, I believe that what they're talking about is a remote only option besides only for the medical. I could be wrong, but that was my understanding, was an all remote option. And there was the chart, that showed schools.
I think by and large, what we're doing is consistent with what most other districts are doing. Most districts are not running a parallel remote structure. We don't have the capacity to do that.
Yes. Okay. So in that chart, the article, right? Superintendent talking about. So what it's saying, the remote or virtual, your understanding is those are also for those cases where families can give documentation.
Not universally, but by and large, that's true. We're also in that article, even though we're not, one of the 100 largest, we're the largest in Maine. And so we're also included in that article. And it does show that we have the remote option.
Okay. So I guess just in following up on that further, do you see any circumstance during this year? I hear what you're saying about capacity, but I'm wondering if you see any circumstances changing during the school year, which would change the plan for the remote piece being more robust or more accessible to families that don't have that, meet the criteria now.
No, I mean, I see us potentially being all remote, and, based on case counts and things along those lines. And in that case, then we will transition to remote instruction. So when people talk about what will happen, that's what will happen. Our kids will go home and they won't come back to school. Instead, we'll be teaching them remotely in the same way that we did last year. Not something that any of us looks forward to, but that's what we envision. And so, that would be an expansion of remote learning. But I don't envision a system where we run a 700 student remote school in the same way that we did last year. I think it's fundamentally important for everyone to understand that the American Academy of Pediatricians stresses the value of in-person instruction. And I think the fact that we notified the 700 people that were in remote academy last year, and that we have 21, 7 of which have legitimate medical documentation, tells you that while you may hear a lot from individuals, that there is not a significant desire for a large remote option in our community. And so I think our focus is on providing instruction in person to the students that are, yearning to be in school.
Okay, thank you. I think my other questions would be more for Ms. Vo and probably the superintendent. Maybe I can follow up with some additional pieces. So I think some of my questions, and I apologize, I mentioned the article in my last question, but I think this is more my question for from the medical perspective. So that quote that was in the article that was about people being, sitting together eating and having masks off. And I know some community members, shared this in public comment as well. I think I would just love to, I know this is all emerging data, right, about Delta and the variants, like that we don't have the information that we did last year about the 6 feet and 15-minute exposure. And that was kind of how plans went last year, right, based on those recommendations. So I'm just wondering if you can share any data that you are finding that gives any other, even if it's not that specific criteria, if it is, does any of the information that you're finding help with, give us any guidelines about when kids are unmasked? I guess that's what my question is, whether it is trying to be outside. Do we have information about how far or how long it is being unmasked in what proximity to each other?
Well, we're following the guidelines from the state and the CDC, who are prioritizing, kids being in school, and that this is some safe, not the safest, but is an option that we can choose. And we've added, the pool testing as another factor, since we aren't going to have the distancing. I have heard Dr. Shaw say there is much less risk outside with or without masking. I don't have specific data, no, on distance or, with a variant. But I think, we're following the guidelines as we did last year and trying to weigh it all.
Okay, so thank you. So outdoor eating, we know that decreases
Better.
risk.
Yeah.
So I have heard, as a district, I have heard in the plan, the superintendent shared that prioritizing outdoor eating when possible sounds like part of mitigating, right?
Yeah.
Sorry.
Nope.
Okay. I guess I'm also wondering, so this is not relating to eating, but I'm curious, the two other pieces about masking I'm wondering about are the mask quality that I know a couple of people brought up. I just wonder if you can cite any information about that, about, whether having medical masks, KN95 masks, both for students or staff, would be significantly more effective in preventing transmission.
I can't really. I know, we've been providing the K95s for staff or their own cloth staff. We do require at least a double layer, well-fitting. We don't allow masks with valves or ties or bandanas or anything like that. There haven't been any recommendations for the schools for any higher grade masks than that, at least at this point.
And I'm sorry, did you say this? Can you just clarify about the masks for staff that you said is KN95? I didn't know that.
Well, the state supplied medical masks and KN95s, and we had N95s for staff who wanted them last year.
Okay, so when staff requested them. Mm-hmm. Okay, so maybe Superintendent, would you mind just sharing if that's been a discussion at all about masks or not? Is it?
It has not.
Okay, so at this point, I would assume most people are probably wearing cloth mask, wearing students and staff their own. So I guess I'm just, I'm not saying that that's something that I'm, advocating as a top priority, but I think it's something I would like to maybe have some conversation about, because I do think quality masks could have some impact here. So I think the other piece about masking is the outdoor. And I think one of my concerns about not masking outside, and I'm thinking, especially for pre-K to 5, is the taking them on and off. I'm just really honestly thinking about young kids and the going out to recess and coming back in. And logistically, to me, I feel like a simpler and safer way is, I'm not against them ever having mask breaks, but in just my thinking about how kids operate and, coming and going in and outside, I have some concerns about kids playing really close to each other on the playground, so I guess that's just a place where I wonder if it's worth the risk of saying always outside, no mask. So I don't know, Superintendent, if that's been a place of discussion.
it is we've discussed it and we've obviously come out where we came out. So.
Oh, sorry, I didn't catch the last part.
That we discussed it and we decided that we were going to retain the unmasked outdoors, again, consistent with the guidance that we've gotten from the CDC and from our medical professionals.
Okay.
We ran summer school this year with, no masks on outdoors. And so that's the thinking that went into it. And that's our recommendation.
I wonder if maybe there isn't data yet about it because, some schools have started, but I'm just curious, having seen some cases myself in camp this summer. So it's anecdotal. So I'm not saying that's a scientific, but, they're without masks outside. I wonder, I just wonder if that's a risk that's worth taking. So I guess that's just my commentary. And my last piece is about the threshold percentage. And I think this is a really important conversation that I understand at this point that it sounds like that will be made once we have the data about vaccination, that will be made. But I would like to hear from colleagues on the board, but I really would like that threshold to be very high. I would like it to be 90%-ish. And I feel like between 70 and 90 is a pretty big leap to me. So I guess I don't know what the answer is. I'm not a medical professional, but I just want to say that I would like to hear other input about where folks feel that that's a safe threshold. So that's just, I guess, a comment. So thanks.
Thank you, Ms. Russell-Better. Ms. Bondo.
Thank you, Madam Chair. Just need a few follow-up questions here on the. Yeah, I see we have the pool testing on September 20th, and we have returning of school on August 31st. I just want to see the gap. There is a reason, maybe some other technical issues, and why we have to wait until September 20th to start the pool testing, because anything can happen.
Right. So I actually, maybe we'll be ready September 13th. I didn't want to commit to that here tonight because there are a lot of things to get in place. We have to meet. We haven't met yet with the staff that are coming in to run this whole thing. We got to get permissions out and back, develop rosters, develop the nurses' portals. Just, there's just a lot of logistics. We might be ready to go on the 13th, but maybe, we'll shoot for the 13th. I just not having met with the staff that are going to be assisting with this, I just don't have a good sense of how long it's going to take to get it all ready.
Okay. So do you have a team around you, or you just the only person leading it?
Concentric has a staffing partner in Portland called Elevate, and they will provide some on-site administrative assistance to the nurses in the building.
Okay.
And on test day, they will collect the tubes and do some of the stuff to get it sent out. But we haven't met with them yet, and the nurses haven't had their training. That's going to happen next week. And so that was my thinking of the time. But we will work to get it, have it up and running as soon as we can.
Okay. Hopefully we can get them as soon as.
Yes.
All right. So my second question is about the students on quarantine, because I just want to figure out the instructions we sending them home with homework and let them be responsible for the homework. Do we have any structure for them if they need any support, like a guidance or social emotion from the school or teachers, for them to be able to access those services when they are quarantined?
Of course, our teachers will continue to support their students when they're in quarantine. They will not be able to teach them synchronously or record lessons and have those types of, sort of the same level of support that we would provide to students in class. But when they come back, they will get assistance completing any work that they didn't complete while they're gone. If their parents have any concerns or anything along those lines, all they have to do is contact their teacher, their principal, and obviously that is our primary interest, is in making sure that kids receive the support that they need.
So because we will have the remote academy for specific students in medical near exemption. So could they join the remote academic team pool of when they are quarantined or not?
I mean, I think that it would be incredibly complex. It's something that we can look at, but every teacher has different things that they're teaching at different times, different assignments, and to have a teacher in the remote academy who already has a group of students assigned to them, also figure out what it is that, the second grade teacher at Ocean Avenue, the third grade teacher at Lyseth, and the fourth grade teacher at Longfellow assigned and need that particular student to do, the time that it takes to build relationships with students, given that, they're going to be excluded from school for at the most 10 days. So I think that all of that just makes it incredibly challenging to sort of figure out how to do that. But again, our interest is in making sure that those students are supported and, continue their learning and, have those relationships with their teachers.
Okay, thank you. So my other question, I was able to print all those ventilation and windows because it was really the most important, because it's one of the different layers for mitigation. So I see during high school, when I look at most of them, during high school and Portland High School, they still have issue with ventilation.
Say more. I mean, they have issues with ventilation.
Yes, I tried to see some are here. So I saw the index here on what the none means on the ventilations and also on the windows. So most of the school that I see, they have a none. Yeah, I just need to understand a little more what's the meaning on during high school what we mean about ventilation. None. I mean, is not any windows and then any ventilation.
Yeah, I mean, and I don't know, is Steve still on here, or Doug? Steve Reed and Doug are here. Steve Stilfen is also here. Steve, can you speak to that, please?
Could you repeat the question, please?
Yeah, the question is, in our high schools where it says none for ventilation, what does that mean?
If a room has no ventilation, then it has no outside of a window. If it's indicating a room that doesn't have a window, it certainly wouldn't be a classroom. Unless I see what room number are we talking about?
So for example, in,
I have here.
I mean, at Portland, starting at the top, in the girls' locker room, it says that there are no windows, ventilation is good. Let's see. The gym teacher's office says none for windows and none for ventilation.
In that case, that it has no windows and it has no mechanical ventilation in that particular coach's room used as a coach's office.
So what do we do about it?
We don't occupy it.
Are we going to use it for students, or we won't use it? So can we be able, because that's a lot. I took the time to print everything because this is one of the amazing layers for mitigation. So when we have a closed door, when we don't have any ventilation, any good aeration, windows closed, and then we're going to winter. So I wonder what's going to happen with that specific layer.
I think what Mr. Stilfen said is we would not occupy that.
So we don't. So can we at least have some idea how many rooms in the Portland High School or Adhering High School won't be able to be occupied? Could we?
It would, Steve, is it fair to say that anyone that says none and none is not occupied?
That's right. That's right. Without particularly remembering this specific room, I would imagine that square footage is very small and it's been used as a coach's office pre-pandemic, and there was never mechanical ventilation in it, and it never had a window, and it's just been moved into and used. And as we developed this plan for the pandemic, we identified spaces that have had occupational creep in the areas that were never designed to be rooms. We've turned closets into storage rooms, into areas for special educational working areas, and the pandemic has exposed that. And those rooms that have no mechanical ventilation or a window, or in some cases no electrical outlets, then we don't occupy those rooms.
Okay. All right. So okay. Can we be able to get more updates on those repair and ventilation windows?
We have replaced 100 and some odd windows in Portland, Adhering, and Longfellow. Every classroom has at least one, and many that had none prior to operational windows have two. So that chart you're looking at, Ms. Bondo, indicates that our rooms that are occupied as classrooms have operable windows. A minimum standard or a minimum number of one are operable, and many have more than one. So we've replaced hundreds of windows in these three schools, and we're intending to, with CIP money, to replace more as we continue on in this process. But our classrooms throughout the district, when it comes to ventilation, as far as windows, every classroom space has operational, openable, and operable windows to provide extra dilution of air, inside air coming in, whether they're mechanically ventilated or they're in rooms that, like in Portland or Adhering, where there is no mechanical ventilation in certain wing of the school. So windows were the only way to provide classroom ventilation, with the exception that all of our schools in the corridors have mechanical ventilation through rooftop units. So opening a door to a corridor would allow some ventilation. And if you notice, many of our doors have vented panels on them to allow for that air circulation. So we do not have classrooms that are not ventilated, either A, by a dilution by opening operable windows, or B, with mechanical ventilation installed either in univents or rooftop mechanical systems supplying outside air.
Okay, all right, thank you. So my last questions, I just want to emphasize what Mr. Russell just mentioned about the data for the staff. So we say we're doing some survey. So I wonder about the survey. The survey, we just asking question if they are vaccinated or not, or do we asking for any proof of vaccination? I mean, the proof of vaccination, then showing that they are really vaccinated, or we just going with the yes or no question?
We are getting proof of vaccination.
Oh, okay. All right. So we just need to wait for the following meetings. All right. Thank you so much. I'm done, Miss.
Thank you so much, Ms. Bondo. Mr. Burke.
Thank you, Chair. Superintendent, over the summer during Sun School, were there any cases reported of COVID, and how many people were quarantined?
I know we have a couple, but I don't have a full accounting. Aaron, do you know?
There was just one at the high school level that involved a very minimal number of quarantines. I forget the exact number off the top of my head, but it was less than one hand.
Oh, okay. And no reported transmission from that positive case? Okay.
None.
Thank you. With the reporting that's being done about vaccination status, I know you're planning to bring that to, I think it's September 7th. It says 8th in the slides, but I think our meeting's on the 7th. When will you have the information of who's vaccinated?
I don't know. I think that's, we're shooting for that time. We are in the process. It's a fairly elaborate process where people need to bring their card and their, manager needs to sign that they saw the card. So, our goal is to have that in time for the reporting to the state and obviously for discussion here.
Okay. You may not know offhand, but you noted that 95% of respondents in last spring's survey said they intended to get the vaccine. How many people responded to the staff survey out of how many total staff do we have?
I think it was 642, and that was roughly half of our staff.
Roughly half. Okay. I don't fully understand the rationale behind the site-specific mandates that you foreshadowed that you may be interested in part because you said data informed, and for me, I just think about vaccination status is a key correlation to infections, transmission, and severity of disease, and that's like just a top-level data point. So could you speak a little bit further to your thinking there?
If we had the overwhelming majority of our teachers who were vaccinated in a location, and the percentage was less than, say, 90% because we had people who have only incidental contact with students be the ones that are unvaccinated, I would be less likely to recommend that we have a universal vaccine mandate in that location, where the potential result of that would be losing staff that we can't afford to lose, and who by virtue of being masked, having relatively little direct contact with students, would be much less likely to carry the infection. And so that's, I think, my thinking on that.
So it's actually more about department than it is about location. Is that what I'm hearing from you?
Yeah. So for example, bus drivers, there's, we need 100% of our bus drivers to be vaccinated. It doesn't make sense to do a department like if 95% of our bus drivers are vaccinated, that means that there's, 3 that are driving who are not vaccinated, and that would be problematic.
Right. So I feel we're a little ahead of ourselves with the timing of our school. And if we know that there's certain departments that we would want to have vaccinated, why wouldn't we make that known now so that the time would be had for the vaccinations actually occur, knowing that, I don't know, it just sounds like we're already clear. We want teachers, we want ed techs, we want bus drivers, we want certain departments to be vaccinated 100%. So why wait on that, regardless of what we find out in the survey that we'll have after school's already open?
Just because I think that we should have the data before we make those pronouncements. If it turns out that we're 99% vaccinated already, making the pronouncement doesn't seem, it gives these guys, a bunch of ammunition, but it doesn't really add any value. And so I think I would like for us to actually have the information before we make the.
I'm sorry, I missed. Who gets the ammunition?
The media.
Oh, okay. Thank you. For pool testing, there was the question raised that I thought was a good one about have we explored the possible disparate effects of pool testing protocols on students with disabilities, in terms of they would not be able to participate for some reason or another, and then they'd be more likely to miss more days of school.
Mm-hmm. I mean, the actual swab is extremely accessible to most students. So
it
I don't
is,
know.
Yeah. I mean, there will be some students that won't tolerate it. I don't know what we can do about that. I mean, it's we can try. We'll try, but I don't know what we can say if it's not tolerated or they can't do it.
Okay. Well, thank you.
I mean, I hear what you're saying. I'm not sure there's an answer to it.
Yeah, well, I guess to hold ourselves accountable for, this is perhaps for discussion later, but just continuing to get our disaggregated data on who participates and who's affected by quarantines. Okay, so I had asked previously, and it wasn't addressed this evening thus far, is Concentric collecting any biological data from the swabs that they are storing, have an ability to sell, et cetera? And this is coming from the DNA tests and things that have been happening in that space that I have concerns about. I heard that the identified information won't be accessible to Concentric, but I'm not clear on what they have in their fine print related to the biological data they're collecting.
We have included in the packet, we have the FAQ document from Concentric on that specific issue of DNA, what they do with DNA data. So you can read that. You know, they claim that they have no interest in doing anything with that, you know, to the extent that you know, that you believe what they've printed, that's what they say.
Okay, thank you. I missed that in the packet. I apologize. There was one thing in the slides that
we have somebody
Are they
from.
still on? I'm not sure.
I don't know who. Do you know who that would be?
Ann Strickland or Benjamin Rome? Sorry.
No, it's okay. Thanks for looking out.
Yeah. No. Okay.
Yeah.
It's okay. I'll read through. There was something on the slides that I just needed to clarify. It was at the point where it listed non-participating students and related to what would happen with them depending on quarantines. And it's just all non-participating students in our pool testing are simply unvaccinated. Like they're the same. There are no students that would be close to the pool testing that have a vaccination because of their age, right? Okay. There was just something that tripped me up when we were going through that. All right. On the when folks are quarantining, you had shared that students will receive assignments from the teacher and will be responsible for completing the work consistent with current practice. Does that mean they'll just get they'll get a packet? They'll get a.
It will depend, you know, on the classroom teacher. That's our policy.
Are all students receiving devices again this year? That will be valuable. And, okay. What's our process to determine a remote learning threshold for class quarantine?
So we're looking at, you know, figuring that out. You know, we suggested that maybe 50% of the class, and at that point, they would go remote. I don't have a tight answer on that right now.
No, you don't.
So that's what we're thinking.
Will it be determined before the start of school? Yeah, okay. Related to supplies, cleaning, and ventilation, are we providing masks again this year? I wasn't clear from our discussion thus far.
Are we providing what?
Masks to students, to teachers, staff.
We have, and there's a document in the packet that has what our quantities are at this point. So we are providing masks for any staff that needs them or wants them. We also have thousands of student masks as well. So we will, and you know, we will continue to purchase those as necessary for anybody who doesn't have them.
Okay, thank you. One thing that I wasn't clear from our conversation on ventilation, in the spreadsheet where it says repair, but it doesn't note that the window was replaced, does that mean that the window still needs to be repaired and replaced?
Steve, can you answer that, please?
Yes, when it says repair, my understanding of this revision to this spreadsheet, and remember, Counselor, Board Chair Member Burke.
Can you get closer to the mics, Steve?
Yeah, when it says repair, and Doug, chime in here, please, if I'm correct in this interpretation, is that we identified it for repair and it was repaired.
Okay, there's just an inconsistency because some places it's very clear in the notes that there was a replacement or a repair made, but I guess that's the difference. It was replaced versus repaired.
Yeah, some of the windows, sir, some of the windows we could not repair, and we replaced, and it was in the numbers of hundreds. Many of them were repairable, such things as balances and springs and so forth. They're generally very large windows, and over time, the balances get out of adjustment so that they're operable for a normal sized teacher to be able to open and close with some ease. So that's what that means.
Yeah, thank you. Thank you all for enduring my list of questions here. The cleaning protocols, I know there's something included in the packet, but it seems it's really related to after a known infection. Have we changed our daily and weekly rhythms of cleaning for this coming year? It would seem we have, because we're adjusting the schedule, which previously had allowed for a certain rhythm of cleaning.
Yeah, we have several documents in there, and we also, Mr. Reed, who is our director of custodial services, is also here and can help to answer that. But we have the cleaning strategies sort of document that just is our general, sort of cleaning protocols to prevent flu and other infectious outbreaks. And then there's a specific document that, talks about what to do in outbreak cases. And that's the second one, the COVID cleaning protocols. And then probably the most useful one at the board level is the at a glance schedule, which sort of shows you who's doing what when and how frequently. So we tried to provide, the most detailed to the at a glance, perspective. So.
Right, thank you. And I don't expect you to walk through that line by line, but it's just fair to say it's different than what it was last year. Is that true?
Yeah, and maybe Steve or Steve Reed or Steve Stilfen, can you talk about what's different this year?
Yeah, I'd just like to remind all of us, and we all know this, it's been a continuum for us in custodial cleaning throughout the district. We've never stopped. Every day we're cleaning to protocols and standards that are shifting from the guidelines of CDC. And Mr. Reed can walk you through some of the more specifics of those changes as we've all had to live through this time here. So, but remember, we've not stopped. We're increasing ventilation efficiencies, cleaning efficiencies, COVID cleaning teams every day since this pandemic started. So the documents you're seeing now are going to change as these protocols are either tightened or we get out of this pandemic and when we get out of it. So, Mr. Reed, you're free to speak here.
Okay, thanks. Thank you, Steve. I appreciate the comments. For outdoor learning, what does encourage mean and what does when possible mean?
It means that we're encouraging it and that there are times when it can be done and other times where it can't be done. And so I know that that's lacking in the level of detail that you would want us to have. And, I'm just very honestly telling you that when I, have this conversation with our on the ground staff, that they all agree, but they also know the limitations of their ability to do that at all times. And so that's the reality that we are dealing with. And so I could stand here and say like, oh yeah, we're going to like eat outside every day. And that's not going to happen.
Yeah. Okay. Well, I'm disappointed in that reality, but I also understand it is the reality.
We're committed to moving aggressively. And, I think that, the investments that we've made, we went from nothing to being nationally recognized, in a year with minimal resources invested. We have, an outdoor learning coordinator. We've done a significant amount of work. So they're not walking into, sort of a, sort of ground up. They're walking into a fertile environment. So I think that overall, we're going to do more than most. And, I believe that we're going to continue to be on the cutting edge of what school districts are able to do. But, the reality or the desire to have everybody be outside all the time, that is not, that's not going to happen. So.
Yeah, I understand that. And I have my pedagogical reasons, but from a COVID perspective, we know it's one of the, safest environments to be in. So just to know that there's not going to be uniformity in how we're outside, thus not predictability for families to understand what the risks are for their students is more where I'm coming from at this time. But I understand all that you're saying.
I understand your.
Related to remote, do we have the demographic breakdown of who utilized Remote Academy last year?
We do.
Can you share that with me another time, please?
Mm-hmm.
Thank you. And then just for clarification, on the website form, it says for high school students, they will be supported through online courses by a faculty member from their school. And the slides say that they will be supported through existing alternative education options. Are those the same things, just said differently? Okay. All right. Here's a couple big questions to bring me home. Can we delay the start of school until we have better information about vaccination rates and pool testing can be implemented with certainty?
Can we? Yes. Should we? No.
Okay. Can you say more?
I think that we want to get students into school. We can't do pool testing until we have students in school. So, for us, and so we need to, there's work that we're doing to get ourselves ready to go with that. And, as soon as we have it, we will start. We set the 20th, was originally the 13th. We gave a little bit of grace to our staff to be able to get everything that they need without feeling that they're overwhelmed. That's the balancing act for us. And, for us getting students into school on time, full time is, the single most important thing that we're focused on. And, the vaccines, again, even if if you decided today that you were going to require everybody to be vaccinated, that process is not going to be done until October, so we would be starting school with, people unvaccinated, or we wouldn't be starting school until October.
So that being true, and I don't necessarily disagree with you, I'm just going through my decision tree here. Can we implement protocols assuming that there's no vaccination until we can prove otherwise? For example, we were highly effective last year in a non-vaccinated environment because of the protocols that we had in place. The guidance that we're following now is in part assuming vaccination with some differentiation between that. So are there not things that we should do to ensure the highest levels of all the layers of protection until we have that key strategy of vaccination in place? Because it's been said over and over again, that's the biggest tool we have.
But that would mean that we would not start school, or we would start school in hybrid, so that we would keep everybody in cohorts and doing all of those things that we did last year when we didn't have vaccines. And so I think I think it would be, against the American Academy of Pediatricians sort of guidance and CDC's guidance around, prioritizing having all students in school. And I think that's what I just want to keep coming back to, that we are as close to those guidelines and going beyond those guidelines as pretty much anybody. And so I think that, to go beyond that to a point where it runs counter to the scientific guidance is what we're trying to avoid.
Okay, great. Again, I don't necessarily disagree going through a decision tree here. That being said, can we delay certain items like the school visitors or being open, well, you already moved the outside groups until all protocols are active? Unless it's educationally related.
Yeah.
Yeah, okay.
Yeah, I mean, I think that, there will be a lot of disappointed school staff who are looking forward to meeting their students' parents, but I hear that, and, there's a part of me, and I know that Tina agrees with this as well, that, understands that there are, risks associated with that we could potentially avoid.
Yeah, and it doesn't mean it has to be not for the whole year, just not September
right.
or, okay. Thank you all for your generosity. I appreciate it.
Also, just to jump in there, I mean, it could be, for instance, I believe at Reiki, the plan is for teachers to meet their students and families outdoors. So there's that opportunity as well. Mr. Youssef, and thank you so much, Mr. Burke.
Thank you, Madam Chair. I have a question about when a student is quarantined. In that period of quarantine, do we have a plan to follow up with siblings who may or may not go to the same school and see if they need testing or?
Will you say that again? If they're quarantined?
A student?
Yes, yeah.
In that period of quarantine, do we have a plan to follow up with siblings?
Oh, right.
Who may or may not go to the same school with him?
Right. So if a student is out of school in isolation because they're positive, yes, the siblings, we would want them out and tested, and we can set up testing directly through Greater Portland Health for the siblings and the family.
Okay, thank you.
Yes.
That was actually my second question about
yes,
guiding them
okay.
in a testing area.
Yep.
A clarification, when there's a positive case, the whole ball team will go quarantine.
No, so if there's a positive case in the pool of the 10 swabs, each of those people will be tested, and the ones that are negative, as long as they're not having symptoms, can stay in school. Only the positive person will have to go home and isolate.
And those who are not in the pool but are considered close contacts, those would also have to isolate or quarantine, sorry.
Right.
Oh, quarantine, okay. Okay, if a student that got test positive gets sick, is there a plan to follow up?
So yes, anyone that tests positive, that we would be reported to the CDC. So they would have someone following them from the CDC, and the nurse. We have a big tracker that we keep track of all the students and the number of days, and so the nurse would be following up before the student comes back with their symptoms and making sure that they're out for the number of days that they need to be out.
Oh, thank you. This may be for the superintendent. Unvaccinated educators, are we planning incentives?
So right now we are planning to offer an incentive to anybody who is, who's already vaccinated or when they become vaccinated. So we are, as part of the data collection process that we're currently going through, we're offering $100 to anybody who is, who proves that they're vaccinated, and anybody who isn't but will subsequently become vaccinated will also be eligible for that incentive.
Yeah, I think I'm good. Thank you.
Thank you, Mr. Youssef. Mr. Rodriguez.
Thank you, Chair. First of all, Superintendent, I want to say that I really like the revisions that you made to the plan from the last meeting, and they make sense. And it shows the flexibility that the plan allows you to operate within. I just have some questions to better understand how we arrived at decisions. As you know, I said last time that I was concerned about the lack of remote learning opportunities. So I just want to understand, when we contacted the 700 students who were on Remote Academy last year, when do we contact them to offer, to find out about this year's?
It was in the spring, but I don't know. I mean, do you need like the day or?
No, I'm just wondering because of what, obviously things have changed with the Delta variant. So if someone's preference would have changed.
And it was primarily to get a sense of how many people. It wasn't like this is your one and only opportunity. So I don't know.
And I guess, I'm sorry. So the follow-up question to that was, what was the response rate from the 700?
I would need to double check. I don't have that off the top of my head, but it was a thorough reach out to everybody through Remote Academy, led by Dr. Giesman and the teacher leaders last year. And so we felt pretty confident that the number that came back represented, families that may still be interested.
Okay. So. Yeah. That'd be if it's possible to get that information. I think I would particularly like to see it in correlation with what Board Member Burke asked a second ago, which is a reminder of who was participating in Remote Academy, so we understand what the response was like. Mm-hmm. I just wanted to make the board aware that the policy that governs makeup opportunities, that policy has not been revised since 1992. So just want to make the board aware of that. I don't want to steal any of the board's time.
I do believe you're the chair of the policy committee.
Pardon me? Yeah, I know. and so you've opened the floor to unnecessary comment. Yeah, it was last revised in August 26, 1992. I actually remember exactly where I was at that day. That was 2 days. That was 2 days after Hurricane Andrew struck in Miami, and that's my mother's birthday. So we were in line getting water at a Walmart parking lot. Back to work. Typical me, right? Sorry. The other question I had was about, you made a comment about should we consider vaccine mandates, the bargaining discussions that need to happen regarding the cost of testing. Would we envision that testing and if there were any accrued cost of vaccination, that we wouldn't pick up on those?
I think those would be the kinds of things that we would have to bargain, so I mean, I know just from reading the media about the city's mandate that, people are, if they are not vaccinated and they need testing, that they're going to have to do that on their own time, that there's not going to be any compensation for it and so on. But they also need to impact bargain that. So, that's where they're starting, and, I don't know where they will end.
I agree. So without really understanding the details of what that conversation would look like, I would just like to offer that I don't necessarily like that part of the city's plan. If it's possible as part of the bargaining, I would like an opportunity to offer that we cover any costs that are accrued due to that mandate. So whenever we get to that point. The only other question was, and this is more of a comment, without the universal mask outdoors, I think even more important that we have extra masks in the classrooms, as kids might lose them taking them on and off. God forbid they start trading them with their classmates. So just to be prepared for that, and I'm sure teachers are. I was actually listening to one of my pre-K, my friends who's a pre-K teacher, and trying to ask her, what was your experience with the mask last year? So she just mentioned that if we're not going to take them in and out, just make sure that we have replacements. And she did want me to mention that families were really awesome last year about having their kids come to school with masks and even extra masks. So she wanted me to make that clear as well. The last thing I wanted to say was I appreciate when we look at the data based on departments, and when if we start to consider vaccine mandates, I think I appreciate the distinction between staff that have direct prolonged exposure with students and those that don't. And I'm very sensitive to the challenges that we would have if we were to lose staff, that would disrupt our ability to run an organization, i.e., janitorial staff and food services. We can't feed our students, and if we can't disinfect our buildings, this entire plan sort of kind of falls apart. So I appreciate the distinction that you're trying to get at. And when we get the data, we'll move forward. I just want to say that philosophically, as an institution of learning, I would like us to rely more on information and education to try to reach our goals of vaccination thresholds. I think that that's how we advance without having the divisiveness that ultimatums and mandates give. But I'm confident that when we look at that data, we're going to see a very high vaccination rate within our staff, particularly our teachers. I'm confident that that's the case. And if I'm wrong, then we will revisit this discussion. But I'll wait to see that data before I would push anything like that further. And that's it. Thank you.
Thank you so much, Mr. Rodriguez. Okay, I have a few questions, and then I can see if there's any other questions from the board. And just to remind people where we are in the process, we'll finish board questions. We'll then take public comment on the proposal, on the plan, the reopening plan, and then we'll move to board discussion and a vote. I have just a few questions remaining. And, one is just the challenges with the Delta variant moving so quickly through communities. And I heard during the public comment at the beginning of the meeting so much concern about how the Delta variant is transmissible, or the transmission, and how it differs from what we had previously been facing, and our understanding of 6 feet and 15 minutes, and what the transmissibility is today. And I just wanted to, perhaps ask Nurse Tina, but my understanding is that we would certainly, to the extent that we have more different information about the transmissibility of the Delta variant, that would then be the CDC and the state CDC, the federal CDC and the state CDC would update their recommendations, and we would then, as we have all throughout the last year and a half, we would then update our plan. So, I'm saying that, hearing the concern, understanding the concern, there's so much conflicting information out there. I think people feel like there's a lot of unknowns. But I do want to come back to the fact that we have public health agencies that have provided us recommendations throughout the pandemic that we in Portland have successfully implemented and not had transmission in our schools. So any thoughts on that?
Right. No, I would just agree. We do have agencies that are keeping up and changing recommendations. I mean, I think that speaks to why we didn't have all this information 3 weeks ago, because we're using new information. The nurses meet, regularly with other state nurses, with a state nurse consultant, and she's part of the DOE CDC team. And there's sometimes there's just little tweaks to the plan, and then sometimes there are bigger, changes in the recommendation. I don't know if you've seen the Maine DOE toolkit with all of those recommendations, but the standard operating procedure was just changed, and we met today for an hour going through all of those changes. So I expect, we'll make a decision tonight, and then there'll be, recommendations coming down the line that we may have to change a little bit. So
thank you. That's very helpful to hear. So just a recognition that our plan is informed by the science, and it will continue to evolve as the science and our understanding of it evolves.
Right.
I had a question that I'm realizing I'm not understanding around pool testing, which is if a family if a student isn't opted into a pool, that pool tests positive. So the student who isn't in the pool is then quarantined at home, could that student's family decide at that point to get them a test, either through us or directly, and then present to us a negative test and come back to school?
So they can't test out of quarantine because part of the reason that people in the pool don't have to quarantine is the ongoing surveillance. It's not the one-time test. So, so no, they couldn't get out. But the pool testing will be open to, continually get people to enroll in it.
So could someone, it makes a lot of sense, but just to push this a little bit further, could a student in a classroom, pool comes back positive, the student isn't in the pool, quarantines, could that student get a negative test and opt into the pool?
And opt into the pool. Yeah, maybe. Can I say maybe? I think so. We're going to
Right
meet
now,
with the
it's
people.
written, it's written into the state SOP that they need to live out that quarantine. I get the question. I
Okay.
don't know
Yeah.
what the answer is, but we can,
Yeah.
explore that.
Okay. And then just coming back to the issue around adults being in the building who aren't vaccinated, whether it's volunteers or families. I do think as we move down the path of considering looking at our vaccination rates among different staff and different buildings, and I agree with Mr. Rodriguez that I do think differentiated expectations are very appropriate given that we're also needing to operate our schools. But if we move if we end up mandating vaccinations for some or all of our staff, it feels very awkward for me to allow unvaccinated adults into the building. It does not, I wonder about the fairness and appropriateness of that. So I don't think I personally need a resolution of that today, but just to raise that up as an additional issue for consideration, whether or not we do need to, despite I know there's a huge hunger for people, for more people to be in the building, but in the buildings, but just ensuring that that we're taking every precaution.
Yeah, I think that resonates with us. And obviously, just to give you an example, we've not taken student teachers who were not vaccinated this year. So that was a filter that we brought to bear on that decision.
Thank you. Ms. Stresselbetter.
Thank you, Chair. I just had one additional comment and question. I just wanted to say I appreciate the chair's comment about the CDC recommendations evolving. I understand that, and I could see that we could shift as more information, more science becomes available. But I just have to share that I don't feel comfortable with the differentiated staff piece. I feel like the incidental contact with students is still staff having contact with students. And I don't know that we have all the data about Delta to say that we have the full science, but I think we do know that we're talking about seconds of exposure between potentially unvaccinated staff and students. So I have discomfort about that. And I don't know, Superintendent, if you have information that you can share about the staffing situation, because I'm having a hard time. I do appreciate that we need to open schools. I have both and. I'm not, saying that one is over the other. I understand the staffing is an issue, and I still have discomfort about us separating staff that will still be in spaces with students potentially unvaccinated. So I guess I'm wondering if you can give any more information to help us understand what the staffing challenges that are making that decision that are affecting that decision about vaccines.
And I think Barb is still here. Barb, did you get that information? I know we had talked about getting the openings for both food service and custodial, which are two areas that I've, pointed out before are of concern to us, sort of, I don't know where it stands right now, but when I reported on it before, it was, over 10 in both of those departments. So I don't know where we are right now. And Barb is, but I do want to just, while Barb gets there, just point out that in those instances, we're talking about staff that are going to have incidental contact and will be masked. So it's not like, people are just running around with, no vaccines and no, layers of mitigation. So, it's no different, than, when we walk into a store and buy something with somebody who, is wearing a mask, but we don't know if they're vaccinated or not.
Well, I would argue it is different because we're talking about potentially many hours a day, 5 days a week, sharing inside space, you're sharing breathed space. And yes, it is different than a teacher. That's for many hours. But I would argue that the food service worker potentially walks into a building, is there for not a whole day, but for a number of hours, sharing breathed space with some, differences in ventilation in different spaces. So I just think it's not that I understand their levels of contact in space, but I guess I'm not convinced that the folks that you're calling incidental contact are not still a risk that I'm not comfortable with when we're talking about a building full of unvaccinated students. Oh, thanks, Barb.
Yeah, so I was actually looking for the email that I sent you that had the detail, but I have some detail here. We do, in terms of custodial and food service, we both of those have 12 positions that are still open. I'll be meeting with my team tomorrow to get a full update on where we are in the hiring process, but I know that those pools were very limited. Even the ones that had closed already, there were a handful in most of the pools, less than, 10 candidates.
Thanks, Barb.
Thank you, Ms. Fesselbetter. Are there any other questions from the board? Mr. Burke.
Just to clarify, when you were discussing where there are vaccine mandates, that there was only the state of Hawaii. Is that correct?
And that was for student athletes. That's what we were able to find. Correct.
Okay. So when that search was conducted, had Chicago announced their decision, which was on Friday? Chicago Public Schools is mandating vaccines for all their employees.
That was for students.
Oh, that was for students. I'm sorry.
There are a number of places that have required vaccines for their staff.
Okay. Thank you for clarifying.
Okay, thank you, Mr. Burke. We are now going to move to public comment on the reopening plan. We don't have members of the public still with us in person, so I'm looking at our participants via Zoom. If you would like to address the board, please use the raise your hand feature in Zoom. I see a couple people so far who have already spoken with us, which is fine. I'll give you another opportunity, but I'm just going to first look to see if there's anyone who has yet spoken to the board. Just remind you about the procedures here. You can raise your hand in Zoom, either using the option at the bottom of the Zoom panel or next to your name. And then when I call on you, please tell us your name and your address, and then you have 3 minutes to address the board. I see all people who have spoken with us so far, so I'm just going to go start with Emily Connolly. Emily, I'm going to unmute you, and you have 3 minutes to address the board. Go ahead.
Thank you, and thank you all for, it's been very enlightening listening to all of this. I just had a couple more comments based on what I heard. I was wondering why we're doing pooled weekly testing that does have a lag between when the initial test happens and any, knowing who is possibly infectious and pulling them out of school, instead of doing rapid tests weekly. I wanted to say about remote learning. I mean, up to a month ago, I was feeling really confident about sending our kids to school. You know, if you'd asked me a month ago, I would have said, of course, they're so excited. And just as we're seeing day-to-day pediatric cases and kids going to the ICU is increasing as schools are reopening. And while those don't have the same mitigation plans in place, it's still really concerning. So, you know, to say that there wasn't a big response about remote learning at the end of the spring, I didn't see anything asking me about whether we would do it. Any messaging I saw said it was only for medical necessity. I'm glad to hear that you're going to be adjusting based on recommendations from the CDC and AAP, and I understand the value of having kids learn in person, but I definitely think making sure our kids are safe and getting through this pandemic. We know that there are a lot of implications with long COVID, and we know that there are a lot of kids who are having really bad outcomes from this. So I just want to keep that in mind. And I think that's it. So I appreciate all of this, and I will keep listening to hear what happens. We're going to wind up having to decide if we're going to keep our kids at homeschool and cut back hours and keep going like this, or risk sending kids to school. So it's really hard. I appreciate what you're doing. And that's it.
Thank you, Emily. Thank you for sharing your comments and concerns. Next, I'm going to go to Erin Green. Erin, you have 3 minutes to address the board.
Hi, thank you for taking my comment. My name is Erin Green. I live on Dakota Street in Portland. My children will be attending Lyseth and more in the fall. And I would just like to echo the comments that Emily Connolly just made. My children also were enrolled in Remote Academy last year, and we were all very excited for them to be attending school in person this year, again, up until about a month ago. And that being said, we also were under the impression that Remote Academy was only available for students with a documented medical need. And there wasn't a place on the survey to indicate if we'd be interested otherwise. So I wanted to echo her comments and say that I am also very thankful for all the work, the very hard work that the entire school board is doing. So thank you very much.
Thank you so much, Erin. Next, I'm going to move to Tiffany Bond. Tiffany, you have 3 minutes to address the board. Go ahead.
Hey, I spoke earlier, but in case you need it again, 3 Colonial Road, and my children are both at Row. Just some feedback based on what I've heard in the meeting. I hadn't seen the sheet that was shown on ventilation and windows before. I looked it up, and it appears that it's determined that it's good if windows open. And I can tell you from somebody who went into Row right after it opened as a new building and has had children in that building and has gone to a lot of events as a parent, you know, doing field trips and going in for things. The ventilation is not good with those windows. It is warm in those rooms in the summer. There isn't a lot of airflow. So we need to have a lot more definition on ventilation versus, you know, rather than having it just be, do they open? That is not an adequate measure. I would also like to echo Emily and Erin. Both of my children were in Remote Academy. We were planning to send them back when the questions were asked about coming back in the fall. It looked like the children would be able to be vaccinated by the fall. The news was kind of saying, hey, maybe August or September, children will be able to be vaccinated. I certainly would not have had my opinion on Remote Academy. If you'd asked me a month ago, I would have said, well, they're vaccinated a little late. Delta hadn't really come up. I also was very confident about a month ago that my children would be in school. So confident, in fact, that one of my children did attend summer school in person And I want to tell you, I very much want my children in school. It impacts my ability to save for retirement, to pay student loans, and to run my business, to be home. I felt comfortable and safe with my children in summer school, but then the Delta variant happened, and those were very small classes, and most of their time was outside. You are making these decisions on bad data. You're making these decisions on not having information from parents who want their children in a remote academy during this period. Thank you.
Thank you, Tiffany. Next, we're going to move to Rachel Pargetter. Rachel, you have 3 minutes to address the board. Go ahead.
I just want to make sure that you can hear me.
Yes, thank you.
Okay, thank you. And I spoke earlier and did not give my address. So it is 73 Payson Street in Portland. I just wanted to mention to everyone present that the 9th grade meet and greets for both Portland and Adhering are next week. And from what I understand, I'm actually supposed to volunteer at one of those events, that they will be just as they were pre-pandemic, but with everyone wearing masks. So if we are going to say that unvaccinated adults can't go in to the schools because of what has been discussed today, that needs to be communicated very quickly. Because my understanding was that even younger siblings could come if they wanted to. It's not going to be only high school age students that will be there, and parents and extended family are also invited. So I just wanted to bring that up. And my comment earlier about the bathrooms at Portland, and it does actually say in the document that there's no return ventilation in any of those bathrooms. I don't know what that means in the document about ventilation. It does say that in the summary underneath it that those should be addressed, and I don't know if they've been addressed. I'm really hoping that there will be clarification on that. Having a student who I know will be terrified to go into the bathroom otherwise. So there will be long lines at that one bathroom where the ventilation is certified as adequate in that document. So I just wanted to bring that up. And if you could take that into consideration, I would appreciate it. And I don't need the rest of my time. Thank you.
Thank you, Rachel. Thank you for those flags. Appreciate your comments. Next, we're going to go to Anna Fink. Anna, you are unmuted and you have 3 minutes. Go ahead.
Thank you, Emily. Anna Fink. I also neglected to give my address earlier. Cumberland Ave. I have an incoming first grader at Reiki and an incoming sixth grader at King. I just wanted to share my experience. We were in Remote Academy last year. I have a vague recollection of that survey coming out. It came out at a time that it completely slipped by me. And I've spoken with others who were in a similar situation. So I don't know if you're using the response to the survey from the spring for your outreach now, you may be missing a significant number of people. So I'll just flag that for you. I'll so reiterate, I feel like things are tending towards worse rather than better with this, particularly as we get into the fall. And so taking whatever steps we can is prudent, because I think it will lead to longer time in school for us and fewer disruptions, which I think is what we all want. I think the steps that you're taking are commendable and bring us to a point where we can safely reopen. And I'm happy for that. I would really encourage a long, hard look on whether a couple more weeks of planning and information gathering and setting up pools and being ready to do pooled testing, that sort of thing, would help us have a smooth start to the year and not result in a bunch of transmission in the first couple of weeks. Decision to push back the beginning of school last year, I can appreciate that. You know, we really don't want to do it again. That needs to be. Thank you.
Thank you, Anna. Okay, I don't see any other hands up. Are there any other members of the public who want to speak to the board about the school reopening plan? John Thibodeau, you have 3 minutes to address the board.
Hi, thank you, Emily. John Thibodeau, 114 Clinton Street. I'm speaking again. Thank you again.
John, it's hard for us to hear you.
Okay, can you hear me any better now?
Yes, but please do speak as loudly as you can.
Okay, I will. So I found this conversation after the testimony to be disappointing. It feels like a disconnect between the public testimony and now what is being discussed. And, you know, I appreciate the enormous amount of work and effort that's being put into this, but at least personally, I don't get the sense that there is the sense of urgency and understanding of how rapidly things are changing. We're not talking about vaccination rates or vaccines that protect at 95%. The best guesses right now, and the data is not conclusive yet, but from people like Dr. Eric Topol, who's the head of the Scripps Institute, you know, the best guesses right now are around maybe 50, 60% effectiveness for the Pfizer and Moderna vaccines. So I feel like that needs to be our baseline from what we're talking about here. And I don't get the impression that that is the understanding in this discussion. So even if you have 90% of teachers vaccinated, it still means that they are only protected up to, say, 50 or 60%. And so then you have an enormous body of children who are not vaccinated. And this is a dangerous situation that I just don't feel the urgency that I think is appropriate here. For context too, I think we're all familiar with the city manager, and he has seen that it is appropriate for the city's employees to be vaccinated. And in this particular situation, it appears that he is more progressive and more in this situation than our looks like our school department, and I think that's worth considering. So I hope there's some reconsideration, and I guess I'll just leave it at that.
Thank you, John. Are there any other members of the public who wish to address the board specifically on our reopening plan? I don't see any additional hands up. Okay, one additional hand. Andy Schmidt. Andy, go ahead. But just before you get started, if there are any other members of the public who wish to address the board, please do raise your hand now. And then we're going to close public comment after Andy concludes his remarks. So Andy, please go ahead.
I just want to reiterate what John said, and this is a fluid situation. I would like to see Portland be the first community in the United States to mandate vaccines for students when that's appropriate. Maybe that's not appropriate now, but let's keep on top of it and be the first, be the leaders. So that's all I have to say.
Thank you, Andy. Okay, there aren't any other hands up, so I'm going to close public comment and we're going to go into board discussion. So this is board discussion on the reopening plan. I do not see any hands. Is there any board discussion? All right, this is your last opportunity to all of the board members.
I'm coming up, trying to go to bed.
No time for that. All right, Mr. Burke, would you like to discuss, do you have remarks you would like to make?
I'm very distracted by my bladder. I'm going to go to the bathroom. May I have 2 minutes? Thanks.
Okay. Does anyone else want to help Mr. Burke out? I will say that both tonight and then over the last few weeks, in terms of the emails and calls and other communications that I've received, I understand the community's fear and apprehension and concern, as well as the desire to have kids back in school and learning, and addressing the need for kids to have as much normalcy as possible. And I feel confident that this plan is based on the science as we know it now, and that we will continue to evolve and respond to the science. I want to thank Nurse Tina and Dr. Gita and the superintendent and his team for all the hard work and careful consideration that has gone into this plan. We are asking so much that on top of running our schools, we are getting into every detail of how to keep our kids and staff safe in a pandemic. It's a lot, and I am I want to acknowledge that. Running our schools alone outside of a pandemic is a huge undertaking and a constant challenge, and this just elevates that to a huge extent. So I look forward to supporting this proposal, this reopening plan tonight. And then when we get the data at our meeting in September on staff vaccination rates, I'm looking forward to having an additional conversation about what those vaccination rates tell us about additional steps we may or may not take in order to further protect our students and staff. And then pending FDA approval, when the FDA has finally has given full approval to the vaccines, I'm also interested in having a discussion among the board about adding the COVID vaccinations to our mandatory vaccinations and understanding what that would mean for our students. So with that, I'm going to see if there's any additional board discussion before we move to a vote. Okay, seeing none. By roll call vote, please indicate whether you are support approving the administration's school year 2021-2022 school reopening plans for a full return to in-person instruction while adhering to public health requirements. Mr. Superintendent, will you please call the roll?
Yes, Madam Chair. Excuse me. Ms. Bondo?
Yes.
Mr. Burke?
Yes.
Mr. Irish?
Yes.
Rodriguez?
Yes.
Russell Better?
Yes.
Ms. Thompson?
Yes.
And Chair Figdor?
Yes. So the plan is unanimous. Oh, Mr. Youssef.
I'm sorry. Oh, my bad. I skipped from Ms. Trevorrow, who had to leave. I'm sorry, Mr. Youssef.
Yes.
Sorry about that.
Thank you, Mr. Youssef. So the reopening plan is unanimously approved. And now we are moving on to personnel items. Is there a motion? Mr. Rodriguez, seconded by Ms. Bondo. Ms. Stoddard, would you like to speak to this motion?
Certainly. So tonight we're bringing forward 10 educators for your approval.
Thank you. Are there questions on the motion? Seeing no questions, there's no public comment on personnel items. Is there any board discussion on the motion? Seeing none, by roll call vote, please indicate whether you support action to approve the personnel items listed, election of teacher candidates. Mr. Superintendent, will you please call the roll?
Yes, Madam Chair. Ms. Bondo?
Yes.
Mr. Burke?
Yes.
Mr. Irish?
Yes.
Mr. Rodriguez?
Yes.
Ms. Russell Better?
Yes.
Ms. Thompson?
Yes.
Mr. Youssef?
Yes.
And Chair Figdor?
Yes, so the motion is unanimously approved. Now we're going to move to adjourn. I will first want to thank everyone for their hard work tonight. I know it was a very long night. Is there a motion to adjourn? Ms. Bondo, seconded by Ms. Thompson. All in favor, just with a show of hands?
Yes.
It's unanimous, and we are adjourned at 10:54 PM. Thank you so much, everyone. Thank you to all the members of the public who joined us tonight, and I hope you get some sleep. Good night.